Okay.
Okay, Elliot, I have
Okay.
to leave my computer on for you.
But when you leave, Marlon,
Yes.
if you have another co-host, it normally tells you leave or end for everyone. And if you only leave, you should have a choice of buttons there because we've done it in the past.
Okay. Okay, yes.
Yeah, you see?
I'm leaving now.
Okay.
So
I'm holding my fingers.
Is not in yet?
No,
No.
he's not in yet.
Yes.
You have his phone number if something goes wrong?
No, I don't have his phone number. Dr. Wang has his phone number. I have only his email.
Dr. Wang's giving a speech now, so.
Yeah. Otherwise, you will ask Sun Leping for his contact.
Yeah, maybe later. If something goes wrong, I'll text you. We can ask Dr. Wang if he can give me some. I don't know. I know it's a privacy issue, but okay.
I have his phone number.
Oh, of course, Vivian. Of course you have. So you text it. I don't know. In the WeChat, you can. Okay, if something goes wrong, Vivian can text him.
Yeah, I will.
Okay. It's question of privacy. Are you allowed to use it? Because you have it. You said what we discussed the other day, right?
That's a very good question. Yeah.
Are you allowed to use the knowledge from the
I think
emergency? Yeah, exactly. Life or death. Okay. Good. I'm not watching the Congress on the other screen.
I just watched a little bit.
No. He's not there.
He's not in yet.
Hi, Shai.
Okay, I'm going to text him.
Yeah, thanks. How's Ruby, Marlon?
Ruby, she's fine. She's fine. She was very excited and happy that she was there.
Yeah,
and,
it's
yes.
It's so educational to see the same person again after.
Yeah. I saw it in her eyes, huh? How she was.
She really looks less sad than last year. I must stronger.
Yeah.
Yeah. She was sharing much more also. So for
much
us,
more,
it's also helpful. She's a very sweet person also.
Vivian, did Dr. Sun react on your text?
Wait, the last time maybe he changed his number because it says the last time he was online is the 24th of October. Maybe I have his WeChat.
Maybe his number is on his website. Like on the clinic, let's see.
There's a number on the website.
Yeah, there's a number on the, but it's a 9 number. Is that
I'll call him.
Okay, great, Vivian.
Or someone else, I don't know.
You can talk in Chinese, you can call him.
My Chinese.
You always say that. Try it. If not, I'll call. Yeah, there's a number on his clinic. Maybe he's in the clinic, so even if it's the landline.
Okay, it's busy.
Maybe he's trying to call Dr. Wang.
Um,
Missed all of it.
Okay, I'm going to start again. I'm start
Okay.
again.
Thank
No,
you.
sorry.
I'm sorry. Okay.
No, we're sorry also.
I'm sorry. Okay.
Oh,
we will
I'm sorry,
start.
I did
Yes,
something wrong. Sorry for that.
Okay. Listen. Do you hear my screen share?
We don't see your screen.
No.
Okay, I'm going to have screen share. Okay.
Yes.
Somebody disabled me. Could you please enable me to share the screen?
I'll do it. Now it should be, yeah.
Oh yes. Okay. Hmm.
There is some background sound.
I
Yes.
know it's me.
Now it's okay. Could you please mute everyone except me, probably, so it's easy. I'm going to start again. Oh, what a pity, what a pity. I talked for 20 minutes for nothing. Okay. Good morning, everyone. So we are going to start from the very beginning. We are going to spend time for this weekend to learn, to discuss, to review the knowledge of TCM for the management of pain with acupuncture. Pain, of course, is the first symptom that appeared during the daily life in the long history of human life. Everybody, no matter is young or old, man or woman, girls or boys, that at a certain moment in their life could suffer from pain. Pain can be a physical complaint, but also can be a mental complaint. The most important is that when there is a combination of mental and physical pain, it can be very worse. And above all, pain is also a warning sign that from the pain degree or from the pain aggravation or elevation, we can see the pain or the disease is going to be progressive or deteriorated or improved. And the pain is not only a complaint, but it's actually a reflection of a disease. It's underlying injury or damage. Sometimes you can see a real physical damage or occupation or something blockage, but sometimes you don't see anything. Because it's not because that the physical examination at this moment could identify everything. Let's say when I started medicine about 40 years ago, the technology, a CT scanner, MR, PET scanner were not existing. The only things existing at that moment was X-ray. But X-ray could not identify many things. For example, herniation, back hernia. They say, oh yeah, you have a little bit of arthrosis. nothing special, but you have radiation, we don't know what's wrong. But actually it was a big herniation. Sometimes if people have a pain, and then they're going to have examination, but CT scan or MRI will show some different results. Not because the CT scan could identify or show everything. Sometimes we need a combination of MRI to verify the detail changes. For example, not so long time ago, we saw a patient suffering from hemiplegia, verlamming. And at that moment, we thought that there was the thrombosis in the brain. But they say, we went to the CT scan, everything was normal. But physically, she had the paralysis on one side. I say it's not normal. And because if there's thrombosis or bleeding, normally they can see some calcification, but they also did not see any calcification. But I insist she is going to be examined by MR. And 1 month later, because she did it in the beginning in Belgium, and then she went to Holland, paid by herself to receive a MR. It cost her about 250 euros, something like that. She went over the border to have this examination. Finally discovered there was a tumor. Yeah. And so not because of the modern medicine with their technology could verify all kinds of the cases. But TCM is going to analyze the clinical symptoms to find out what is the cause, what is the pathology. The TCM give a holistic way of analysis and treatment. During this weekend, we are going to cover 2 parts. Part 1 is a general introduction, including how to identify the cause, etiology, how to make diagnosis, how to make use of the points, because not all the points, 350, 360 points, are able to solve the pain. Each point has its unique function, and different combination could show different effects. So cause factors, diagnosis features, and application of points are the most important parts from first part, general introduction. Afterwards, we also have to learn that TCM is not only going to treat the pain, but TCM also put prevention as first. That means that we have to learn how to prevent occurrence of the pain, how to prevent pain going to be aggravated. 魏翔，魏翔，你说，我
今天在上课呀？
不对的，我在上课的，好了。
你在上课了，他们怎么说没有上去吗？
我可能又下线了，你中按西按又下线了，现在在上课了啊，谢谢你，好的 ，OK，
不好意思啊，不给你，拜拜。
Okay. So we have to understand a good TCM practitioner could prevent the pain effectively. Do you mind tell me that you can hear me? Yes, normally, yes, I can hear. Okay, good, thank you. That a moment ago, I received a call from Wei Xiang. Okay, let's continue. And the second part is going to cover each topic of the pain, because the pain is umbrella. Under this umbrella, we have different complaints of the pain. For example, neck pain, shoulder pain, abdominal pain, meridian pain, organ pain, etc. And each pain has its unique diagnosis and unique treatment. But anyway, we are going to cover a lot of contents during this weekend. I hope that you could learn these materials firmly and practice later on. But one point is also important, I think, to mention, that pain is a reflection of a disease. So management of a pain with acupuncture is not only to sedate the pain, to make the pain lesser, but actually is to treat a disease, to handle a disease. Actually, pain management with acupuncture is a complete topic of TCM. So we are going to discover, to explore this knowledge during this weekend. So let's start. First is about how to manage, how to analyze the cause. Without understanding the causative factors, you were not able to understand the mechanism of pain. The mechanism of pain usually is due to qi and blood stagnation. But don't forget, qi blood stagnation is the final pathology. TCM always talk about etiology, pathology. Pathology is the mechanism, what happened, what is the result. So here, the pain due to pathology is mostly qi blood stagnation. But qi blood stagnation is the result. But there are many, many factors which can cause qi blood stagnation, both excess and deficiency. For example, qi deficiency, old people can also have pain. We can see that in Westers, for example, many old people living in the what we call rest house, wound center. They are old. They are not capable of free movement. That's why they're accepted in the wound center. Those kind of people, they are becoming old. They don't have sufficient movement. They sit from morning to the evening, waiting for their dinner, waiting for their sleeping time. Can you imagine such kind of old people or enabled people have very, very slow qi blood circulation, because this is not a sufficient qi blood circulation, which can cause a lot of pain. You can imagine a person who has a paralysis, who are old, who are sitting under the armchair, roll stools, for example, they will suffer from the pain. You will see. So as long as the qi blood is not moving due to different kind of factors, they will suffer from pain. So indeed, we are not only going to sedate pain to move the qi blood circulation. You use some points to promote kind of qi blood circulation. It's not enough. So if you apply some points for old people who is going to receive acupuncture for qi blood circulation, as long as they don't move, they will have troubles. Okay. And we have to understand that what is advantage of acupuncture to relieve the pain. Relieve pain. Here is some list. If you tell your patient what is the advantage of the acupuncture to relieve pain, it includes following. Of course, you will not able to relieve the pain completely, solve the disease completely if the case is very complicated. Anyway, here is the list that you can help patients to manage the pain, to manage the cause, to diminish the painkillers, to improve their physical movement, to improve their sleeping, to improve their emotions, for example. So pain treatment with acupuncture is not only the procedures to relieve the pain, but improved holistic changes, conditions, especially when people have the pain, their energy will be blocked, the emotion will be blocked. All right. So we're also going to relieve the emotion. Example is that how can we relieve the emotion during the pain? Because we treated the heart, we treated the liver. Yeah. And because the heart is the center organ for emotions, for all kinds of emotions. And also the heart is the center organ for pain. One of the treatment to relieve the pain is not symptomatically, but also treat the heart. In a few moments, we are going to talk about how to choose point to sedate the pain, to manage the pain. One of the methods is to control the heart. Suppose somebody who has a pain, you can see that their sleeping is disturbed, their mind is disturbed, they feel restlessness, their tolerance for pain is getting less and less. So this is the way that if you don't treat the heart, and then the emotion will getting worse. Therefore, we have to treat the heart. But we have to understand why heart is important here, and which point can we use to regulate the heart. Fine. In Westerns, one of the treatment for pain is some medications, painkillers, right? And medication at a certain point are necessary. However, if you take it for a long time, for months, for years, of course, then the sensitivity of the body to the medication will be diminishing. And also the side effect is obvious. And also some people have some side effect which is so big that they have stopped medications. Indeed, in this case, if we can add acupuncture as intervention, and then people can accept it and they can tolerate the pain better. Meanwhile, we also solved the holistic way of imbalance. Therefore, people's general condition could be improved. In Western, the mainstream, as I mentioned, mainstream of medicine is classical medicine. However, if you practice acupuncture professionally, seriously, and also you have a foundation, a good foundation of a TCM, I think your neighborhood, your friends, or other medical doctors will think that you are marvelous. For instance, I'm practicing acupuncture for more than 30 years in a city called Ghent. And Ghent is a city with 4 or 5 big hospitals. One of them is university hospitals, Ghent University Hospital, which is also quite big. But in the last 35 years, I never had troubles with any medical doctors. But on the contrary, so all medical practitioners, if they have heard of my name, they found I'm reasonable, serious doctors practicing acupuncture. They have no one complaint because I have been showing TCM is really helpful. Therefore, I was invited to give lectures for the pain clinic in Ghent University hospitals, pain clinic. I went to also the Vrije Universiteit Brussels, invited by the rector, invited by the CEO, by the hospital, University Hospital Jette. And then I went to the Department of Anesthesia, pain clinic, by professors. Why? Because I want to demonstrate, give lessons. I did give lessons there for the medical doctors, staffs, in the pain clinic, in the the anesthesia department in Yetta in UZ Ghent. Because my publication has showed them that I'm working seriously with acupuncture to help patients with pain, not just use some point to sedate the pain symptomatically, right? In Dutch, they often use a word which is quite negative to describe somebody who is a layman of medicine practitioner, called a quadsurfer, something like that. It means you are cheating, you are not serious. But they never use this term for me. They know I'm a serious person. I believe everybody who have learned this weekend lesson could be a serious person to deal with the pain. Why TCM becomes so popular, especially acupuncture becomes so popular in Westers for the patient with pain? It was due to the fact that Americans and accepted acupuncture widely during the Nixon visit to China in the early 70s. But that is the history. Okay, never mind. But indeed, acupuncture was a famous branch of medicine in China to carry out the research and the clinical application for pain control during anesthesia. That was during the Cultural Revolution. But still, acupuncture anesthesia is sometimes applied, used in hospital. You must be very curious about the acupuncture for anesthesia. Even acupuncture could be used for anesthesia. So for pain treatment, is a kind of peanuts. And why acupuncture could be used for anesthesia? Because here is the advantage. Because it is can carry the operations with less, don't forget, with less anesthesia medication. So people can stay a week during operation, can cooperate during operation. People can show that acupuncture can diminish the pain during the operation, can keep patient a week during operation. So this is already enough to show acupuncture is working, right? And also because less medication, so the side effect from medication is lesser. There is one sign called lack of less disturbance to the brain and memory after anesthesia. There is a university called Imperial University in London. And in this is top university of the whole world. In this hospital, there is a medical science anesthesia department. The head of this department is a professor. One day, I had a conversation with him. I asked him one question, which is anesthesia going to disturb or damage our brain or memory in certain degrees? Because until now, the scientific research denied that anesthesia could disturb the memory or damage the brain for those kind of function during anesthesia. His answer said yes, because he has conducted different scientific research showing that for young person and for old people, after more than two times of anesthesia, this influence is going to be there. But previously, until now, they always deny, no matter how many times you operation by using anesthesia, your brain and memory will not be disturbed. But his research from top university in the West show that anesthesia could damage this or disturb this memory. He has proof. And in TCM, don't forget, anesthesia is a kind of a medication which separated the heart and the sun temporarily, because our heart is related with our sun. Our sun is having its activity in the brain. Brain is the activity place. So when the brain lost its function, make people, anesthesia make people sleeping. So the sun is very much calmed and sedated. Therefore, this kind of artificial separation is going to influence, disturb the memory. So now they have scientific research. I was from my plan to write an article with this professor. However, I did not have so much time. I talked to him. I said, can we write an article from your aspect and from my TCM aspect to show how TCM is so advanced a few thousand years ago, talked about the sun and the brain. He found interesting. But the disadvantage of the acupuncture for anesthesia is that the pain control is not complete. And also for some parts of operation is not good. So for a tonsillitis, for example, delivery, for abdominal operation, for brain operation, acupuncture is working very well. But for some operations, not will work very well. For example, for amputation of the leg, the limbs sectors. The reason TCM also explained, the far from the heart, the less effect of sun control. The closer to the heart, for example, brain, chest, the lung, the better result of pain control. So indeed, for example, to treat phantom pain, most of the phantom pain is the place at the forelimbs. Also, you have phantom pain from the teeth, from the throat, from the lung. Anyway, remember, the closer to the heart place, the better result you are going to have for acupuncture, for pain management. The far from the heart, the less good effect. And so for children, the pain control is not so good as adults. And also on the old people, it is less effective as the young people. It means that acupuncture works with qi, When they are children, the qi are not deficient, but not sufficient. Pay attention to the words. The children, they don't have a deficiency, but they don't have sufficiency. But the old people, they have deficiency of the qi and blood compared to the young people. So if you use acupuncture for pain management, the old people usually don't react so well as young people. Some people have a herniation. Young people could react better than old people. And of course, acupuncture anesthesia is now not so widely used in China, but still in Shanghai, remember, in Shanghai, TCM affiliated hospital, if you want to go to China, you can ask. They are still carrying the operation for some kinds of operation with acupuncture anesthesia. It is interesting. So if you have a chance, just contact them to have a visit, to pay a visit. Let's look at the first part. What is the pathogenic factors which can cause pain? Living in Benelux, for example, you have found one phenomenon that old people, they want to move to Spain, Tenerife. Why? Because in winter period, it is warmer, it is sunshine, less windy, less rain. But during winter period, it's here in Benelux much more cold, humid, and windy. This windy, humid, cold weather could cause people with pain, or at least pain aggravation. So here in Benelux, what the disease we often see is pain due to joint complaint. So we are going to also cover topic B syndromes during this weekend. One of the factors is that there is external invasion. We are living in an environment, for example, Belgium is a country with more than 300 days without sunshine. Can you imagine? 300 days. And we do need sunshine in our nature, but we are missing. Therefore, fruit production, not so much compared to Brazilian, Mexico, those kind of countries, we don't have enough sunshine. And due to this sunshine is missing, not sufficient, we have too much humidity, too much windy, because Benelux, especially Holland, Belgium, are the country close to the seaside. A lot of wind. This wind is relatively cold in winter. Although the Belgian weather is not that cold, however, it's already cold enough to cause pathogenic effect invasion. Less than our body temperature is 30 to 37. Less than that, and any wind changes could cause pathogenic factors. Of course, in winter, we only have 5, 6 degrees, 13 degrees, something like now. At this moment, it is about 7, 8 degrees outside. So it can be pathogenic factors. But how can we know that this pain is due to external invasion? Relatively simple. Here we have mentioned that first is acute. Something acute, less than 3 months, it is called external invasion, mostly. Is that enough? No. We have more than that. Besides acute, less than 3 months, but also we know that there is some external symptoms. External symptoms. It means that mostly during the season changes, summer to autumn, autumn to winter, during these season changes. And also we have some external symptoms. External symptoms means that there's a sensitivity to weather changes, runny nose, worse during the raining, cold weather, etc. And also the feature is that normally there's not so much internal organ disturbance, but pay attention. This can be one factor that if there's external disturbance, it can cause more chance for patient have a certain pathogenic invasion. But how can we understand this saying? It means that one factor, have you noticed that living in Benelux, it is humid, windy, cold at this moment. But is everybody suffering from B syndromes? The answer is no. So it means that external invasion is indeed a strong pathogenic factors which can cause disease. However, that is not the only factor, because not everyone is suffering from B syndrome. Not everyone is suffering from arthrosis. It is only the reason that when people are getting old, getting weak, people have some internal pathogenic factors existing. then the chance is quite big, pay attention. Chance is big that they can attract this external invasion. For instance, if the person who is liver type, liver is in 5 elements, according to the 5 elements, is related with a material called wind. Understand that investors, so many people are suffering from liver disorders, stress too much, consumption alcohol too much, emotion too much. So these internal disorders indeed is underlying pathogenic factors which combine with external invasion. So those persons have wind invasion quickly. On the other hand, the damp person, over body weight, over consumption of the milk product, sweet product, salt product, etc., over meat product, can cause external damp invasion easily. So indeed, external invasion can happen by coincidence, but mostly it's not by coincidence. It's inevitably invasion because of internal disorders. So try to understand the external invasion is mostly not by coincidence. Not by coincidence. It can happen. For example, a young person, a strong person who has just built their house, and the house is not dry enough, and then they moved in because they have a very short term of moving the house. They have a contract with the house they rent. They have to give up to move in the new house. The house is still wet, not completely dry after a few months. So living in such kind of areas, they can have troubles. They can have troubles. They can have a wind, cold, damp invasion, for example. Yeah. So some people live in for example, in Latin America. They are not going to suffer wind, cold, damp, but they are going to suffer wind, damp, heat disease. And especially sometimes they can suffer from the damp heat disease. For example, traveling to Asia, Middle East, Latin America. One of the disease is not from the joint pain, but they are going to suffer from diarrhea. Diarrhea because of this damp heat invasion. And then they can cause stomach pain, of liver pain, of intestine pain because this damp heat invasion. So don't blame the nature. Nature is one of the environment for everyone. For example, Thailand people. Not everyone in Thailand is going to suffer from diarrhea. Not everyone living in Mexico is going to suffer from abdominal pain, intestinal damp heat. The only person who has the troubles because this is your internally disorders. We first talk about the wind. Wind is never combined, we never invade the body by itself. He must combine with some other pathogenic factors. For example, the common factor is wind and damp, wind and cold, or wind and heat. In Westers, in Benelux, most is wind and cold. Or sometimes with at this moment, for example, is a wind, cold, damp. People who have arthrosis, who has a rheumatic complaint, they are going to suffer from this kind of disease. In some cases, and people with muscle pain, they undergo many kinds of examination, rheumatic complaint, rheumatic examination, blood test, and rheumatoid test. Everything shows positive, negative, nothing wrong, but still complain of joint pain, muscle pain. So in that case, in TCM, we consider it is external invasion. But Western medicine, they say, we don't know, you have pain. Or you you have a kind of a muscle rheumatism indeed. So when wind is there, we have to find, is it combined with the cold, or with the damp, or with the heat, etc. Usually, we like this kind of invasion because it's not so deep, not so deep. When it is combined with toxin, something different. 3 years ago, COVID-19 started. If it is only due to wind cold, wind damp, or wind heat, it's not serious. Why? Because mostly it is only disturbed in Wei Qi, disturbed the superficial parts of the body. However, when the wind is combined with the toxins, epidemic toxins, then it's something different. Because epidemic toxins can invade the lung, going much deeper. Omicron, as a variation of COVID-19, is now becoming more aggressive. However, it is causing less severe disease. Less severe compared to 3 years ago, when original COVID-19 virus started. Delta, etc. Those diseases were quite dangerous. At that moment, it can cause huge damage to the lung, immediately causing heart disease and death, for example, because it went much deeper. But now Omicron is more spreading, much faster, but it is less costly factors now at this moment. We hope that Omicron could be the last, the strongest virus variation, but it is getting less and strong and less strong and less stronger, less aggressive. When there's a wind, how do we know that there's a wind is predominant? How do we know that the cold is predominant? We see symptoms. If the nature of the pain is moving from one place to another, it means that the wind is predominant. And also, intensity of the pain is changing. Besides the changing of the places, it is also wind. For example, today is a sharp pain, tomorrow is a slight pain, the day after pain is not so much. All of a sudden, the pain is getting worse again. So it means wind. And also, wind is related with nature, related with your emotions, especially stress. It means that it's a wind. For example, if today is a very windy day and the pain is getting worse, so it means that pay attention, there's a wind is a predominant. If we understand wind is predominant, and which point we should use, we have to use the point to relieve the wind easily. For example, Latin 4, Live 3, Gallbladder 31, Gallbladder 34, Gallbladder 20. Because those points are going to relieve the wind properly, immediately. Usually wind is not going to stay in the body for a long time, We come back one situation, which is very clear, that is acute. So external invasion, not only wind, but all kinds of external invasion start suddenly. And also, don't worry, usually it has, generally speaking, short duration. What means short duration? Less than 3 months. Exceptionally, it can cause long duration, months and years. In which condition? When you have a combination of internal disorders. But the pathogenic factors is the enemy. When this enemy start to invade the body, we have to use methods to eliminate this invasion. The pathogenic factors is not going to be eliminated automatically. Of course, our body has a strong resistance, strong immune system, strong chill blood. You are not going to get weaker and weaker, deeper and deeper. They have a power, resistance to eliminate them properly as soon as possible. However, when the disease are so severe, when the wind is combined with toxins, cold, damp, or when the external invasion is combined with these internal disorders, they can become serious. They can become serious. Just to remember, most of the patient with COVID-19, no matter in the beginning or at this moment, can be free of symptoms in a couple of weeks. But sometimes they are ended at the hospital because they have a basic disease. Basic disease means that they're overweight, they have diabetes, they have a cancer, they have a cardiovascular disease, they have transplantations, they have this and they have that serious complaints. So those kind of patients with basic disease could suffer from a serious COVID-19, and then they can be in danger. They can be in danger. So people who have a COPD, for example, when they receive, for example, the COVID-19 virus, even they are vaccinated, they can be in danger because their lung function capacity is weak. Therefore, we have to pay attention to support the internal organs, to avoid the internal organ disturbance. That's the most important. Here and there, from time to time, to suffer from external invasion, common cold, the influenza, it is normal. It's normal because we are living in an environment with full of the bacteria, virus, full of the pathogenic factors, full of the external invasions. However, we are not sick. We can be temporarily sick, but not have serious sickness. Why? Because our resistance, our zench is still strong enough. On the other hand, many people are suffering from long COVID. So long COVID is not acute anymore. It's a chronic disease. We have to understand what is a long COVID. Long COVID is that this definition made by the World Health Organization, that the symptoms last for more, after 3 months, not yet covered, pay attention. Within 3 months, it is still acute COVID. But from the beginning of the diagnosis, after 3 months, not yet finished, pay attention. And also those symptoms again last for 2 months. Then we call this is a long COVID. So if, for example, people after 3 months, they are not finished, but then after 4th month, symptoms are finished. So it's not called long COVID. So only the person who have suffering from COVID-19, and then more than 3 months not yet finished, again last 2 months. It means 5 months after diagnosis of the COVID, especially with confirmed diagnosis. Of course, this diagnosis can be medically confirmation or clinical confirmation. That in this kind of condition, you don't have other explanation why they are so sick. Then they call long COVID. So again, it shows when people have long COVID, usually the wind, cold or damp toxins are relatively eliminated. So external invasion is not the main task, not the main disturbance. We have to treat the main disease focused on internal disorders. Here, we give you some explanation. External invasion and internal disorders are always connected to each other, especially for chronic cases. So here is a wind. We have to normally no worry. When people have an acute complaint for a couple of weeks, especially related with weather changes, wind, it is a wind. But don't forget, it is superficial. Usually, we use some point to eliminate the wind is sufficient. But also, we have to understand wind is combined with cold and damp or with heat sectors. Next is cold. Cold is something different. Cold is making stagnation. Is yin passenger factors. Cold can combine with wind, with damp, etc. And cold is the situation is not good. Why? Because it can block the yang. The yang is the factor which is power, vital energy in our body to fight with the cold. However, if the cold is extremely too much, for example, now the temperature is outside very cold, and when you're living or working in outside without good protection, then you are going to suffer from this cold invasion. Cold, when they invade the body, they can block the skin pores, and also damage the yang of the heart and damage the yang of the kidney and spleen yang, etc. So cold is not good. Is not good factors. People living in the cold area often suffer from a lot of blockage pain because this cold can make a stagnation. In the beginning, she's stagnation, but afterwards, the cold can enter the vessels, making blood stagnation. When people have a cold, how do we know that this cold is predominant? The symptom is shivering, aversion to cold, preference of the warmth. And meanwhile, people can see some cold complaints. Runny nose is white, discharge is white, and also cold hands. They like warm, etc. This cold means is passenger effect is there. And what we are going to use? We use method to eliminate the cold as quickly as possible. So we can use some points, and especially we can use moxas. We can use some diet to support this cold elimination. Moxa is very important. There is one person coming from Poland many years ago, about 35 years ago, something like that. He was still young. And this guy went with his girlfriend to Tibet. And suddenly, one night, he suffered from abdominal pain. And far away from the capital city of Tibet, in middle of nowhere, dark, cold. And this diarrhea was so severe that he started to have bleeding from the defecation. So this heavy diarrhea, together with bleeding, was enormous scare that he thought he's going to die, because there's no possible to transfer him to a hospital, nearby hospital. Doesn't exist. He prepared to die. But at that moment, there's one tourist coming from Latin America, also a couple. And this couple, a man, has learned TCM. And he has, probably he's an acupuncturist. He said, I have no other ways than acupuncture, moxa, because he did not have needle with him, but he has moxa with him. He went to Tibet, he knew it is cold. He could have some high altitude reactions. So he brought with him some moxa. He said, I could try to save you at midnight in the hotel with moxa. And then he started to do some moxa at his stump 25, then my 4, then my 6, and some 36, something like that. Half an hour. Immediately, this Polish guy feel so comfortable in abdomen. And the pain getting lesser. Diarrhea stopped. Bleeding stopped. So he found this amazing. He said, what is that? He said, it's a system called acupuncture, moxa busting. And his life was saved. And he's so grateful thanks to the acupuncture. So he found that acupuncture is fantastic. Therefore, after coming back from China, Tibet, he started to study TCM. And also, he expanded his thoughts, finding acupuncture is not only good for him, because acupuncture saved his life. Acupuncture must be very good for Polish people. That's why he started his school of acupuncture in Poland. Now he has one of the biggest school of TCM in Poland. I have been giving lessons for more than 10 years in his school, at his school. And it's quite interesting to see that because of acupuncture, who saved his life, he afterwards promoted TCM to develop in Poland. Now TCM is one of the leading country in Ostblock in Europe. And acupuncture is quite developing medicine in Poland. Many people are receiving its benefits from TCM. Wonderful history, wonderful story. So only acupuncture, only moxa busting saved his life. Because the cold was damaging his spleen yang. That's why spleen qi was weak, blocked. Therefore, he has diarrhea, abdominal pain, and blood, even blood, huge blood coming from the anus, come from the defecation. So cold, don't forget, is a pathogenic factor that can block the yang, damage the yang. Long-term of cold in the body, for example, living in cold area, in mountain area, without good protection, can cause damage to the organ and cause stagnation, qi blood, can cause deficiency of different organs, cold. Yeah. Therefore, old people, usually old people have less yang qi, they want to move to Spain during the winter to spend there for a couple of months. This is normal. Belgium, Holland, for example, are good place for young people because their yang qi are still relatively strong. However, when people are getting old, they should think about the living in a good environment, have good house, have good clothes, take care of food, regularly go to acupuncturists to receive acupuncture support to balance their yang qi. Now, this is very important. Don't expect that the classical medicine could offer you yang qi supporting. They are not able, but only TCM is going to change this. So cold, pay attention. Cold, when cold is invade the body gradually, but first symptom they're going to show is a pain, spasm, contraction, and battered by warmth, worse by cold exposure. Therefore, we can see some symptoms. We are going to use moxa with some points to support the yang qi, And of course, we have to understand where to support the yang qi is not to use Renmai 4, Renmai 6. It's because we have to see which meridian has this yang qi disturbance, which organ. Because if you only use Renmai 4, Renmai 6, you only tonify the qi of the kidney. You are not going to regulate the yang qi in some specific organs. Therefore, pay attention for differentiation to see which procedures, which organ and meridians, they have this co-invasion. Next is about the dam. Dam invasion is another factor which can often happen in Benelux because humidity is too much. This is the environmental pathogenic factors. But not everybody is suffering from this damp. Only those persons who living in the humid area. For example, Holland is a place under the sea levels. But Holland people are clever for damp protection. So they have a very good technique to prevent damp. But some houses are too humid. This is number one. And also, Holland is a country with high production, good production of the milk product. So in this case, milk product, living environment are the typical causes, key causes for formation of damp invasion. Because internal damp could attract the external damp invasion easily. If people who have very strong or good health of the body without damp, so external invasion of damp will not easily take place. Meanwhile, generally speaking, the fooding beside milk consumption, eating too much sweet, too much raw products, for example, vegetables, and too much alcohol and other factors can cause external invasion because damp is formed in the body. So don't always blame the external damp, but internal damp environment is the key cause for external invasion. On the other hand, we can say that if damp invasion on the person who are very healthy, who don't have the internal damp, then the external damp will not able to stay in the body for a long time. And also elimination with acupuncture is much easier. And how TCM could eliminate damp, external damp, via triple burner, Sanjiao. So Sanjiao, we have very good points. For example, Sanjiao 4, which is the yuan point. Sanjiao 5 is a low point. Sanjiao 6 is the corridor for the damp. So these 3 points are very important. Together with the points we supported our spleen irrigating the damp, for example. If, for example, Holland is everywhere is cement, concrete, and then Holland will suffer from the water flood because the damp cannot escape anymore. Therefore, our earth is very important to absorb damp. Our spleen function must be strong. So external damp is one factor. Internal damp is key deciding factor to let the damp inside the body for a long time or for a short time. But on the other hand, when external damp is there, how do we identify the damp? We can see that there is heaviness. There's formation of a phlegm in the throat, in the sinus. There's a phlegm from the stomach. People can have a nausea. People can have a diarrhea. People can have a local swollen, heaviness. So those kind of things are the damp. We mentioned the points from Sanjiao points, Sanjiao channels, from spleen channels, also from stomach as well. So that's enough. It's not. The treatment is relatively simple as well, because as long as there's no internal damp, the treatment is still simple. Of course, we have to understand another factor is that besides to prevent internal damp formation, also we have to identify, is damp mixed with wind, or mixed with cold, or it is mixed with the heat. Then besides to eliminate the damp, we also have to clear the heat, wind, cold, etc. So damp is never attacking the body alone. If there is causing diarrhea, vomiting, etc., it is also mixed with the wind, cold, or heat. Therefore, we also have to clear the other factors next to the damp. Damp is a yin. When it is inside the body, it can again also block the yang qi. Again, block the yang qi. And also making cold, making pain. But this pain is a little bit different with the cold. Cold is spasm, contraction. Don't like the cold, better with the warmth. But damp is something different. This damp making pain is never serious, never aggressive, never severe, but it's called lingering. It's heaviness, local edema or swelling. And also, typically, is that the damp is often making troubles with the damp, with the spleen, So usually, to judge if damp is there or not, we can see the spleen is involved or not. We can see mostly spleen is involved. Dryness. Dryness, of course, it is a very typical symptom season in the autumn in China. But here, the fall season is not so typical, and then in autumn, it is also the place with a lot of rain, completely different with that in China. So if you go to China at this moment, you fear that you are going to suffer from dry nose, dry throat, dry skin, especially you go to north part of China. It's so dry, you never had it before. You thought you're sick, but actually it's not, you are not sick. It's only the climate which is dry in nature. But the dryness is going to be a factor in China, not that obvious in the West, but still it is possible. Sometimes some seasons they can be very dry, for example, in the summer this year, June, July, so little rain. Some famous river have troubles with sufficient water. They even can have some troubles with boat transportation. Therefore, a lot of raw material are not able to be transported through the water canal to Holland, Belgium, Germany. Therefore, the price of the metal building materials was increasing dramatically. One of the factors is that due to poor transportation, because of lack of water in the river, in the canal. Dryness is going to damage our lung, because it's going to influence the respiratory tracts, nose, throat, lung. The key symptoms is that people are suffering from dry cough, dry skin, dry nose, dry eyes, for example. Therefore, we have to give some support to nourish the dryness by promoting the secretion of body fluids. But don't forget, this dryness is not because of yin deficiency, not from our body who has too little production, but it is due to external pathogenic factors which disturb the body fluids. It contains two pathogenic factors. One is dryness heat, another is dryness cold. So dryness is not going to attack the body alone. He's going to combine with or heat or cold. If, for example, our nose is dry with yellow phlegm, scanty yellow phlegm, with a burning sensation, it means dryness heat, dryness heat. But if, for example, there is a white phlegm and also aversion to cold, it is dryness cold. Due to this tiny difference, our treatment also should be regulated accordingly. For dryness cold, we have to eliminate the dryness and also eliminate the cold. But if it is dryness heat, we have to eliminate the dryness and moistening dryness and also clear heat. Anyway, dryness is a chief pathogenic factors. We have to moistening. But don't forget, you don't need to use some points to nourish the yin from the body. For example, spleen 6, kidney 3, and kidney 6, etc., etc. It's not the really organ dryness. It is superficial dryness in the lung system. For example, here we have to use lung 7 to dispel dryness, right? We use triple 5 to dispel this dryness. But immediately we have to use some point to moisten this dryness in the lung system. For example, we use lung 9, lung 10, right? To moistening the dryness. We use bladder 13 to promote this kind of a body fluid in the lung. So the rest point, spleen and kidney, the liver, you don't need. You don't need to touch because it's not caused by disturbance of the internal organs. About the heat. Heat is pathogenic factors. For example, in the summer, it was very hot, very hot. It's usually the hot weather here in Benelux is about maximally 1 week, 10 days. Therefore, most people or most family don't need air conditioner. However, in China, in Far East, Asia, for example, hot weather is a main weather in the summer. Very hot, long, 3 months. Therefore, they have to use air conditioning. But heat is really pathogenic factors. Heat can burn, can cause consumption body fluid. It can cause a lot of troubles, And heat can cause overactivity of the liver, heart. Therefore, people can be nervous. Because people can have headache due to hot weather. I remember it was in 87 or 88. A group of Sweden student acupuncturists went with, I think, 40, 50 persons with father went to China, Nanjing, to have a clinical start acupuncture. Half the way, and they all went back to Sweden because the weather is horrible hot. They never expected it so hot. They feel restlessness, agitated, sweating too much. So finally, they decided halfway of their clinical study to go back to Sweden because the hot weather too much. People can imagine that when the fire is too much, they're going to disturb the heart. So they feel restlessness, palpitation, profuse sweating, and also don't feel well with the heart. But also they can also disturb the liver, making nervous, headache, easily emotional, in these kind of things. So a person, can you believe, a Spanish person compared to a Belgian person or Sweden person, you can see the temperament are a little bit different. Spanish people, they can be very warm, not keeping distance like Sweden people, not like Belgian people, but they can be very agitated, lose their temper easily. Positively speaking, they are a warm person, but personologically speaking, they can be agitated person, angry, fighting, quarreling, discussing. It's because it's the fight too much. So if it's from a nature fire, nature heat, it is going to influence their constitutional situation. Therefore, they can be agitated easily, lose temper easily, and can be very emotional. Fire is a good person. Fire is more passionate, a warm person, devoted, dedicated, sacrificed. They speak very warm words. But on the other hand, pay attention. And if they're angry, they can be very angry, and they can be quickly angry. Not like the Dutch people, Belgian people. They have enough patience. Relatively speaking, enough patience can be more quiet for a while. But Spanish people, Portuguese people, Greek people can be very quickly angry. So fire person is burning their physiological functions, stimulating their physiological functions, overreacting of the physiological function, become pathologically.
Dr. Sun,
Yes.
excuse me.
Yes.
At about now, we usually have a little break.
Yes, I'm going to take a break for about
Okay.
20 minutes. In 2 minutes, thank you.
Okay.
Thank you. Yeah. Okay.
Thanks.
So warmth is good for our body, but here is pathologically. We have to see how to see that there's a warmth, redness, swollen, burning sensation. For example, the person, the Polish director of the school of TCM had diarrhea. You can imagine if people in Tibet had diarrhea with burning sensation, with pus formation, with high fever, it's damn heat. It's toxic heat. You cannot use moxa. However, here, the person who has mostly is with water discharge, diarrhea is a light red color, cold hands, tiredness, then you can use moxa. So 5% is different. Fever, redness, burning sensation, hot sensation, fresh red color, these are heat. So what are we going to do? To clear the heat. Clear heat, we have used different points. We use yin point, don't worry, don't be panicked at the yin point. What is yin point? That is the point to clear the fire. We use the yin point. But we have to also choose from affected the channels and organs. For example, this person has fire, then heat, for example, is going to invade the liver. You are going to control, to clear the heat in the spleen, to control the heart, to control kidney. No sense. You have to control the liver too, because it is yin point, fire point of the liver. Again, due to hot weather, he cannot sleep, he has insomnia, he has sweated too much. You have to clean the spleen, you have to clean the stomach, you clean the intestine, not enough. You have to clean the heart, 8, for example, pericardic 8, for example. That's the yin point of the heart and pericardium. So this is the way we have to clean the fire, but we have to make a differentiation. So next step is we are going to make a differentiation diagnosis. Now, it's a time for us to take a break for 20 minutes. So we are going to take a break until 12 o'clock. Then we continue our lesson till 1 o'clock. Is that okay? Thank you.
Thank you.
See you.
Thank you very much.
Thank you.
Bye.
Thank you.
Guys, I'm going to stop the recording now. Remind me to start it again, okay?
Please. Thank you.
Okay.
Thank
Okay, recording.
Okay. Welcome everyone after the break. We are going to talk about the internal factors. In fact, most of the pain that the reason patient to our practice is due to internal factors. The first factor is emotional disturbance. Here we mention that the emotional factors, it means there are different emotions. We don't put the umbrella emotions as the causal factors to every patient, because we have to analyze different emotion has different influence. The most the factors we're going to encounter in practice is anger, stress, yeah. But we also have different other emotions, of course, because TCM classified emotion into different factors. For example, joy, anger, sadness, fear, frightened, etc. The reason TCM did it like that is because they want to make a close connection with different organs. If, for example, people have anger, of course, it can have big influence to the liver, but also it can influence the other organ, for example, heart, lung. But don't forget, the main organ which is going to be affected is the liver. So in this way, TCM narrowed its connection and make the precise diagnosis of the organs. When the emotions started, TCM also make a second step is to see which kind of a qi regulation it can cause. For example, anger make the qi stagnation, make the qi uprising, but fear make the qi sinking. And for example, and the joy make the qi moving slow down. But here, joy is not means that means that people just feel happy. No, means excessive joy. Excessive joy. If it's excessive joy, without root, it is pathogenic factors. So here, the emotion means negative emotion. The joy, normally it is good. However, if it's pathogenic emotion, it means excessive joy. It means that people don't care about life seriously. They find everything is okay. Okay. And so here is one sentence. Okay, it's very clear that TCM already mentioned that the mechanism of each emotion could cause different damage of the qi and blood circulation, especially qi activities. When people have the emotions, don't forget, we have to go deeper to find out which organ is involved, why people have this kind of emotion. For example, if people have, for example, pain due to neck pain, and if you find it is due to stress, so you have to relieve the stress, support the liver, regulate the qi, but meanwhile also have to make them feel happy. Try to relax the liver. How can relax the liver? Besides promoting qi circulation, we also have to understand the 5 elements, the internal relation. For example, when the liver is too much tensed, we understood the liver is wood, right? We have to make the lung, the metal, be stronger to control the wood. We also have to understand that when the liver is excess, we have to reduce the sun to control the heart. So it means if people have stress, we have to treat 3 organs: liver, central organ, the lung organ to control the metal, control the wood, and also reduce the sound of the heart to let the excess to be diminished. It's not because people have stress, you only concentrate your attention for the liver, for the liver, for the liver. Then you forget the lung, you forget the heart. But if people who have during the menopause, who have the liver problems, tension, nervousness, headache, high blood pressure, you understood this is because the water is not sufficient to support the wood, the water. So you have to regulate the wood, liver, and also meanwhile to regulate the kidney to supplement, give supplement for the water, the kidney. Otherwise, you will not able to deal with the liver properly. So we make clear, identify which emotion is making damage to the organ. Find out is excessive or deficient. If it is excessive, we have to control, reduce the sum. If it's deficient, we have to tonify the mother. But don't forget, we also have to understand the 5 elements to regulate the lung, to control the liver properly. So this is the way that TCM gave a holistic way treatment, this emotion. When the emotion is excess, we also have to understand that liver, for example, liver is excess. He will not only have sickness in the liver self, he might have an invasion to his control organ. For example, his control organ is the spleen. He will over control the spleen. So somebody who have, for example, abdominal pain, colic pain in the intestine. Don't forget that we have to treat the intestine. We treat the spleen, but don't forget that it's caused by the spleen. We are caused by the liver. We have also to deal with the liver as well. So we don't forget 5 elements relation. That is about the emotions. Emotion is the main factors here in Western. Now people not talking about so much about the insufficient food. However, most people are suffering the disease due to chronic pain is from the emotional disorders. After emotion, food mistake is also one of the factors. Previously, for example, in poor country, underdeveloped countries, or developing countries, food shortage was the main problem. However, this problem is globally speaking is solved. Seldom people are suffering from food shortage, except war, nature disaster. It can be the trouble, but mostly is due to food intake too much, including following aspect, including something too much. Too much refers to raw material too much, cold material too much. This is one factor which can damage the yang of spleen and causing cold damp. But secondly is due to inadequate food take, something taking quantity too much, okay, or irregularity. For example, avoid morning breakfast and also eating too much during the supper in the evening, and some food eating too much, alcohol too much, fat too much, sweet too much, etc. So many factors we have to take in consideration to see the food is balanced or not. In Western, one of the main problems is that overeating, overconsumption, including dietary products or carbohydrate products or alcohol, sweet too much. So food is one of the factors which making disturbance. The one consequence, what we often encountered in practice is damp formation. So pay attention. So if the coating is greasy, yellow greasy or white greasy, it means something wrong with the diet. And also, the third aspect is that the unsanitary food. In Western, for example, it's not always is the case that we eat good, healthy food. Sometimes there's pesticide, chemical product, preserved product too much in the food, sectors. So this is also one of the factors we have to pay attention. Clean, hygienic, and organic as much as possible is our advice for the good food. So we don't go further because food we can talk a lot about the factor which can be pathogenically. And then next is stress. Stress is outside of the emotion, means tension. And a certain tension is necessary. Certain tension is give people a motivation, give people a power, give a power to give stress to develop. However, if it is too much, it can cause negative effect, especially when it is lasting for too long time. Of course, it can cause trouble with the liver, but also can influence different organs, heart, spleen, stomach, etc. So we have to see that stress is not only from the job, but existing everywhere, from relation, from the financial situation, from environment, etc. Most people, I have to say, I must say that are not happy. Not happy. It's not because material shortage, it's mentally unsatisfaction. If you look at the people, I believe 6, 8, or 9 people are stressed, are unhappy. Why? They're demanding too much. Yeah. They are not able to handle their emotion too much. The reason is very clear. In TCM aspect of view, that people did not learn how to handle their emotion, handle their stress too much effectively. Stress is a word that is a person's capacity to deal with the tension. Somebody can tolerate the tension, manage tension perfectly. It means that in TCM point of view, their balance is relatively good. However, if TCM found that their balance, qi, blood, yin and yang, or other organs are not in the balance, then they are not able to tolerate stress better. So pay attention for stress. We have to train them, educate them, express their stress, express their feeling, try to satisfy it. And in this case, it is good for society, good for their own body. Very easy, very easy. And investors, people are always looking at your financial situation. You have big house, you have big car, but they don't develop quite well the balance, inside balance. That is the future task for TCM. Good point is that in Holland, more than 4,000 acupuncturists are working for the society. Lovely. So everybody who are practitioners of acupuncture, they know this task. They are going to help the people, society to have better life. Most people, they don't talk about this. You have a sleeping problem? Okay, then go to psychiatrist. You have also pain? Take painkillers. You have this and you have that? Go to house doctors. But actually, acupuncture can help people a lot. Overstrain. Overstrain is a situation including the person that overworking. And especially ladies, they take care of the family, overworking. Sometimes they have to the labor working, they have forced themselves, they have herniation, muscle overused, they have tennis elbow, they have herniation, arthrosis, damage, etc. So this is also factors can cause troubles with many damage of the qi blood. Some people have too little physical exertion, yeah, and people are enjoy automation, and also they have cars, they have a bike, they have everything comfortable. So this is also the side effect of a modern life. So people have less qi and blood circulation. Like I mentioned, that during the life in the womb center, it means that people are in the rest house, elderly house. They don't move enough. They sit there from morning to the evening, waiting for the dinner, waiting for the sleeping. Day after day, they will have qi blood circulation. Those old people are suffering from the different kind of pain. Different kind of pain. Anyway, people have to work. Anyway, people have to less stress and sufficient movement, but not overwork. Talk about the injury. Injury is another factor which can cause pain, direct pain, acute pain. The main cause is qi blood stagnation, damage to the tendons, muscles, bones, etc. But the injury also include operations. Here in Westers, they have different operations. Sometimes operation is necessary, but don't forget, operation is a kind of a physical intervention, a damage to qi blood meridians. Anyway, because operation can cause a kind of a formation of a scars. And these scars is nodulation in TCM, is damage to the joints, muscles, tendons. So it can cause qi blood stagnation in any way. So people who have an operation, for example, a hernia operation, appendix operation, for example, the consequence is possible that there is injury to the meridians. In this case, we have to rebuild the qi blood circulation by moving the qi blood circulation in the meridians. So pay attention. Most of the consequence of the physical trauma is due to qi blood stagnation, especially the later blood stagnation. Okay, now we are going to talk about the pathology. We talked about a lot about the etiology, the cause. The consequence relatively simple, which is disturbance, disorder of qi blood circulation. Mostly it's qi blood stagnation. Can be qi stagnation or can be blood stagnation, can be both qi and blood stagnation. So we have to understand which symptoms are belonging to the qi stagnation, which symptoms belong to the blood stagnation. The true treatment with acupuncture is to regulate qi or blood circulation as perfect as possible. So qi stagnation, of course, is the standing pain, moving pain, beginning of the pain. Blood stagnation is stabbing pain, worse at night with fixed location. Mixture of qi blood stagnation are symptoms of the above symptoms. Secondly, is that besides qi blood stagnation, the next step is that there's also internal organ disturbance of damage. If there's only qi blood stagnation, the treatment is relatively simple because you don't need to restore, recover the organs. However, when it is a long term, it is necessary to see if the internal organs are also disturbed. But when they are both disturbed or disordered, the treatment is much more deeper and also long duration. Now we make clear. Anyway, we make qi blood circulation. And also, if necessary, we restore the function of the internal organ. That is our main pathology for pain. Of course, we have to understand most of the cases of pain is due to excess, but sometimes it's due to deficiency, qi, blood, yin and yang deficiency. In that case, we have to promote the qi blood circulation. Meanwhile, also we have to tonify deficiency at the same moment. Otherwise, the qi blood circulation will have stagnation again. Now let's look at the differentiation step. How to make a differentiation? First of all, how do we know it is an organ problem or channel problem? For example, somebody come for pain, shoulder pain, neck pain, pain on the leg. It is possible that in some cases, it is only channel disturbance. What is the necessity to make this difference? It's simple. That when the organ is healthy, you don't need to touch the organ. You only have to treat the channel disturbance. For example, somebody have a hernia, yeah, and the hernia is caused by hernia lumbar 4, 5, or L5, S1. Doesn't matter. Somebody has a hernia at the neck. As long as there's no internal organ disturbance, or people have a hernia, but he has stomach heat, he has insufficiency of the heart, but not to relate with the gallbladder, which has hernia disturbance. You don't need to take care of those heart or stomach problems at the same moment. Later on, you can. But people don't come say, oh, I have stomach pain, I have heart pain. But people really come for their herniation, low back pain, radiation to the bladder meridian or to the gallbladder meridian. So it is the first step to differentiate if the pain is due to internal organ or due to channel. Due to channel is locally, the pain running along the channels. Seldom see symptoms from internal organs. Pay attention, pay attention. So in this case, this is the first step we have already succeeded. Second is that we have to understand this pain is due to external invasion or due to internal disorders. As mentioned, if it's external invasion, for example, I standing outside waiting for my bus coming, but the bus canceled. I have to wait another bus. So I stand in the rain for half an hour, cold, windy. So next day, I got low back pain at my right side along the bladder meridian due to the fact that I have caught the rain and cold. So in this case, it is external wind, cold, damp invaded to the bladder meridian, for example. Because I never had pain in the low back, it's due to the cold weather. So in this case, it's acute. I have external symptoms and also involvement meridian. So the treatment is simple. Give some points to expel the external invasion and also regulate in channels. That's all. Treatment can last 1 or 2 or 3 times, it's finished. But if it's internal, it is a chronic one. It has been there for a long time, I don't have any external symptoms. Then we have to regulate the internal disorders. So this is the second step. Now the third step is to see if it's deficient or excess. Majority is due to excess. 80–90% is due to excess, but sometimes due to deficiency, due to old people, due to insufficient chin blood, due to operation, due to food diet not enough, but usually not so much. Or in some cases, it's external, in excess and deficiency are mixed to each other. But still you have to find out which is the root, which is the main cause, and treat the main cause and take care of the secondary cause. Deficiency, including qi blood yin and yang. Excess, we have different factors. Qi blood, yang, damp, etc. They all belong to the excess. How to make deficiency, make a differentiation? We can see the nature of the pain. If the pain is stabbing pain, sharp pain, aggressive pain, constant pain, and it is excess. But if it is slight pain, up and down, intermittent, it's a deficiency. And also, the deficient pain, pain due to deficiency, is usually worse after walking, after menstruation, after bleeding, after the lack of life care, but most is due to excess. And also we have to make differentiation to see what is the character of the pain, because usually the pain is excessive pain, showing sharp pain, stabbing pain, boring pain, like the needle, like the ball machine, like burning, like electricity, like this. But slight pain, intermittent pain, and also pain by rest, etc., due to the nature of deficiency. So we have different steps, but these steps are helpful to make a quick diagnosis. Now about the diagnosis. Quick diagnosis is based on history, medical history inquiry about what is your main complaint. Most important, what is the main complaint? If a patient says, yes, I have many complaints of tiredness, I'm now, because of COVID, I have also very low energy, sometimes I have pain, but then your treatment direction is not for pain. Your treatment direction is for improvement of long COVID. When people mainly have complaint of pain, then your direction treatment is to relieve the pain. Say, what's the problem? I have neck pain, I have shoulder pain, I have low back pain, I have heel pain, I have painful urination, right? So you have to write down the main complaints of the pain. Among the 4 diagnosis methods, first is inspection. So when you know that patient has a main complaint of pain, you have to see if it is serious or not serious. It can be dangerous, life danger or not life danger. For example, people have a heart infarct, right? You say, oh, don't worry, it's blood stagnation and it is blood channel blockage. No worry, okay? I give acupuncture, go home to sleep. No, it can be danger. It can be danger. So how do we know it is life-threatening or it's ordinary pain? First of all, we need always a cooperation between the house doctor, specialist, patient, and you. You don't judge, because if you are not a medical doctor, you are only acupuncturist. Don't make a medical mistake. In the case which is seriously life-threatening, you have to judge from the following aspect to see we don't make any mistakes. Otherwise, you will be you have been having troubles. Vitality. Vitality is that to see what is the sun movement, and if the sharping pain in my chest, my blood pressure is going down, 8 and 4, pale face, low voice, so sharp pain, or pay attention. It is aorta broken, for example. And then they can be serious. No worry, it's only Qi deficiency, heart Qi is weak, no problem. I do some points for pain. Not possible, not possible. Vitality is damaged, vitality. So people are joking, people are telling the history, people quiet, okay, for a long time, they have a clear diagnosis, and then it's okay, vitality is good. They can cooperate with you, they can respond to your question quite well. Suddenly the loss of faith, loss of consciousness, they're going to be fainted. They cannot answer your question, they have confusion. Pay attention, vitality is very bad, pay attention. And also look at the color to see if it's a good one, it's a red color, pale color, purplish color, etc. The most important is to see the tongue diagnosis, to see the color, shape, the movement, speaking clear, and also we can see the sun. And if people who have a pain also see the place, ask people where is place to see if there's any swelling, deformity, depression, disformity, etc. Right? Okay. People have a sclerosis. They say have a low back pain. Say, don't worry, it is a rheumatic disturbance. I'm going to help you in 1 or 2 treatment. No, you cannot change the sclerosis, right? You have to have some correction with the orthopedist, the local, and also some where some stone zone, etc., cooperation, right? And also see wound, if there is a wound, local swelling, pus formation, for example, joint movement, etc. So inspection is very important. Next is palpation. Palpation, you have to know the place to show where is the pain, to see if there is a deformity, to feel is nodulation, depression, there is swollen, there is any changes. You have to move, to touch, to see if there's a temperature changes, hotness, coldness, swelling, etc., etc. A lot of cases, if it's a meridian problems, we can see that people have, for example, local nodulation. It means there's blockage. For example, small kyst, a small kyst. And if a small kyst, it means there's a local blockage. That can be pain. So you can puncture. But don't forget this nodulation must be clear. It's not a lymph nodulation. If it's lymph nodulation is growing up, pay attention. You have to have a clear diagnosis. Is this due to inflammation or due to cancer? You have to have a further medical examination. If a swollen is already 2 centimeters bigger on the neck, you say, don't worry, it is a meridian blockage, but actually it's a stomach cancer, a lung cancer, lymph cancer, for example. You have to pay attention for that. And then the most important is to see, to have a pulse formation, to see excess deficiency, acute, chronic, external invasion of internal disorder, pulse formation. I believe everybody has a lesson already. So for diagnosis, we have to pay special attention for inspection and palpation. Concerning the treatment, we have 3 steps. First is to search the root, number 1, to see what is the real cause of this pain. We can never only offering the treatment symptomatically. We have to see the root cause. Sometimes there is a root cause. There's also secondary symptoms. For example, people have headache. But headache is a secondary symptoms manifestation. But its root cause can be liver yang rising, liver Phi rising, blood stagnation, due to blood deficiency, etc., etc. We cannot only use some point to control the secondary complaint without the root cause. So it means our diagnosis must be accurate. Once your diagnosis is established, the treatment, such as point selection, point manipulation, etc., will be simple. So must be clear for the root cause to be found. Second is that to regulate the qi blood circulation and also eliminate pathogenic factors. As I mentioned, most cases of the pain, 80–90% of the pain, are due to the excess, due to qi blood stagnation. So qi movement, blood movement, eliminating the pathogenic factors are important. Here, expel pathogenic factors. That means that it's only expel external pathogenic factors, also including all kinds of pathogenic factors exist in the body, damp accumulating in the body, fire accumulation in the body, heat accumulation in the body, etc. Blood existing, blood stagnation, So in this case, the qi blood should be moved. And also factors which cause qi blood stagnation should be also eliminated. Not only means that you use dispersing. Here, expelling means to eliminate all kinds of pathogenic factors. Don't think about that you have to tonify the qi blood for most cases of pain. No, that's not the case. Seldom. For example, in young children, for girls, for boys, when they have what we call the fluid pain, growth pain, joint, tendon, muscle pain, at that moment, you have to also to give support of qi blood, kidney gene. But mostly is the tonification of qi blood yin and yang are not the case for pain. It happens, but not much. That is the second step. And then next still is that we have to identify the yin and yang, to see if it is a yin and yang excess or deficiency, Finally, our treatment, which should be automatically in combination with the climate, the personal constitution, and also your personal habits, eating habit, the environment, working habit, the factors. So not because you're living in the Benelux, you are going to have automatically accumulation of damp. Some people could have too much fire because their diet are different. For example, Moroccans, Turkish people have a tendency of overweight problem. The reason is that I explained to them that they have eaten some baked product too much. They have eaten carbohydrate food too much. So they have a tendency of accumulation of damp. Majority of Turkish people, or Western people, Moroccan people came to practice. Older people, they have diabetes. Due to diabetes, have a consequence of cardiovascular disease, kidney disease, digestive disease. A lot of people came for cancer. I said, the first priority things you have to do for those kind of people is to change your diet. You eat too much carbohydrate, coating is greasy, they have a cancer, they have nausea, they have a swollen abdomen, they're overweight, have diabetes, meanwhile now developed the cancer. I said, it's the damp which block the qi, which block the blood, making qi blood stagnation. In the beginning, you did not pay attention for their diet. Eating sweet too much, yeah? Fruit, they eat too much. Carbohydrate, eat too much. They eat too much flours. Bread, eat too much. Potato, too much. So majority people eating too much carbohydrate, too much damp. Okay, so in this case, we have to put our geographic location as consideration, but we have to also see individual reaction. So this is the reason. For example, if you move to Tenerife, not so many people have a B syndrome because the weather, warm weather promoted qi blood circulation. But here, cold weather make qi blood stagnation. Now let's look at the principle of treatment as simple. We understood the pathogenic factors is a qi blood stagnation, internal disorders. So it is very simple. Principle treatment is to make this qi blood stagnation, to promote qi blood stagnation. But we have so many points. Which points can be used for qi blood stagnation? Afterwards we talk about the point selection. Secondly is that we have to regulate internal organs, no matter it's external invasion or due to ordinary qi blood stagnation. Internal organ is the key cause of this kind of disturbance. If your internal organ is balanced, normally external invasion will not happen. will not happen. Except that your internal troubles is not solved due to organ disturbance, then you can have pain. Finally, one trick is very important, is that in order to control the pain successfully, as a shortcut, we have to regulate the mind. Sooner or later, people are restless, agitating, because the pain causes disturbance, causes sun disturbance. Finally, the heart is ruler of the organs. No matter it is heart or spleen or the kidney or the liver, anyway, heart is the organ like the queen, like the king, going to be affected. Therefore, points to regulate the heart is a shortcut, is one of the symptomatic treatment for controlling the situation of the pain. Like during the war, the most important is how to catch the counterpart generals, the commanders. Because if you can persuade the commanders, persuade the generals, and then the war can be easily under control. Don't talk to the soldiers, because soldiers are only the fighters. They cannot decide. Yeah, only the commander and the chief generals, they can decide the direction of the war as same. So our heart is the organ which can relieve the pain greatly, because also don't forget our heart is also responsible for vessels, for blood circulation. So when we give a practical treatment, we give, first of all, causative treatment to eliminate the cause. If it is external invasion, wind, cold, damp, heat, we have to clear it. If it is due to emotions, we have to calm the emotion. If it's due to stress, we have to quiet the stress. If it's due to the diet not so good, we have to regulate the diet. It means we have to use the causative factor. This is number one priority. Without this priority, if you only treat symptomatically, the second step, use point to promote chi blood circulation, it's not enough. Because in this way, the pain will come back. And also the effect of the pain control will not last a long time, And also is that during the treatment, we also should automatically treat the consequence of the pain, which is a chi blood stagnation in majority. So automatically put the points to treat the chi blood circulation. We have the points to treat the wind, cold, damp, right? To treat the liver stagnation, to treat the heart fire, treat damp. That is causative treatment. But we also have points to treat symptomatically, like the sun calming, like the Shikra points, etc. To symptomatically, to sedate pain, like painkillers. But also we have to mainly work for the pathological changes to make chi blood circulation better. For example, that is why we often use large intestine 4, liver 3. Why? Because these 4 gates points promoting the chi circulation well. We use spleen 6 automatically to promote blood circulation well. But sometimes we also use heart 3 or bladder 15 well, because it's making chi blood circulation better. However, this is number 2nd or 3rd step. The first step is to treat the causative factors. That's the most important. People have fire of the heart. Why people have heart fire? Without treatment of the heart fire, you are going to use some chi blood circulation, use some heart mind regulation. They are okay, but they are only secondary treatment. Extra explanation, how to deal with the points to calm the mind to treat the heart. First of all, think about what are the points which are able to regulate the mind, regulate the sun, to calm the sun. How many? Many, but not that many. Here we have different points. For example, heart 3, heart 7, pericardial 6, gallbladder 20, gallbladder 20, GB 20, and also some extra other points. But indeed, those points are very effective to calm the mind, calm the sun for pain. So suppose tomorrow or day today or Monday, if you practice those points in your daily practice, you can see you can use the 2 or 3 of those points is not enough. You don't need to use 7, 8 points to treat each patient. No, that's too much. And you will observe, interestingly, that as soon as you put these points regulating, mostly is reducing method, you will see the pain is diminishing. Patient found amazing because they saw you are a kind of a magic person. The reason is very clear. After puncturing those points with reducing method, and the sun is quiet, this is the same way that you diminish or close the gate from the vertebra to block the nerve cells, transferring the neuron to the brain. When our brain receives less neuron conducted by our spinal cord, so the body reacted as less pain. It was in our mind, in our brain, they interpreted these neural changes as a pain. Then start to react, oh, it's pain, you're crying, you are restless. But once the mind is quiet, then the pain is lesser. So during the operation, in the surgery, people give anesthesia. People start to sleep. Then the surgeon can cut, can operate. So the pain is still there. However, patients don't react properly because they are sleeping. The sun is quiet. Normally during the sleeping, in ordinary condition, even you are sleeping, our sun is still active like a dog, still watching, protecting. However, due to the anesthesia, this function of anesthesia has separated the heart and the sun. So our brain temporarily stopped work. Our heart is sleeping. Therefore, people don't react to the pain due to the operation. But TCM is exactly carrying out the same effect, that they separated the sun and the heart for the time being, separate. Don't let the heart to be affected by the pathogenic factors, but the pathogenic factors are still there, That's number one we have to understand. Number two is that among those points, still we can use some other points. For example, bladder 15 or Duma 11. We still have many good points. For example, and gallbladder, for example, gallbladder 8, Duma 24 sector. We Duma 四神聪 extra, etc., and Anmian extra. We have plenty, few other points to calm down the mind, calm down the sun. But what are the difference? What are the difference? Which is working better? Working better to calm the pain. Actually, TCM has already illustrated the difference between different points. For example, we take heart 3 and heart 7 as example. The difference is quite big. Heart 3 is called Sao Hai. It is the C point of the heart meridian. And heart 7 is called Shen Men, the gate of the Shen. Is the gate of Men. Compared to the sea, it is huge ocean. Sao Hai. Hai means sea, ocean. And Shen Men is only the gate for the Shen. When people go out, it is always in the same way that you move from deep up to the corridor and then go out. So heart 7 is exit of the Shen, is a place where not so much energy of the heart. And high means very deep. It's the C point. Compared to these 2 points, heart 3 is much better. It's much better. Heart 7 is the Yuan point. Yuan point is not so deep. Yuan point difference between the C point is that Yuan point is for meridians. C point is mostly for organs. That is much more deeper. And also, for example, Duma 11. Duma 11 is called Shen Dao, the road of the Shen. This road is extremely important. It's on the corridor that is going to the Shen, like the ladder, like the place going to the parasite. Very important. So this is much more important, much more deeper than heart 3, heart 7, blood 15. So Duma 11. Duma 11. Of course, we don't have much time to explain detail. Anyway, I give explanation. All those points, they are okay. They are okay. You can use 2 or 3 points symptomatically to calm down the mind during the pain treatment, no matter it is due to deficiency or excess. Okay, so this is a kind of a painkillers symptomatically.
Professor Sun,
Yes. Yes.
what about Shandao for calming the heart?
Which one?
Shandao, it's
Shen Dao is Duma 11, you mean, sir?
sorry, Shantang on the
Shen Tang is Duma 24, you mean, sir?
no the
Yin Tang, you mean Yin Tang?
it's 3 soon from Hsinchu. It's bladder 44, I believe.
Oh yeah, okay. Shen Tang, very good. It is also for mind, for restlessness. It is also good. It's equivalent as blood 15. However, blood 15 is mostly for heart organ disorders. But the Shen Tang, it is 1.5 turn next to the blood 15. It is more for spirit disorders. Compared to Duma 11 and the Shen Tang, Duma 11 is even better. Of course, you can use 2 points at the moment. Duma 11 and also the Shen Tang. Shen Tang. So this is a combination make the Shen much more direct, much more calmer, more effective, better than heart 7, heart 3 sectors. So So when Shen Dao is 11, Shen Tang is the point 3 chun next to Shen Tang to my 11. Very interesting, very interesting. So, but don't forget, all those Shen coming points are placed in the third place. So first place is causative treatment, damp, cold, heat, and the next step is symptomatic treatment, make qi blood circulation. The third treatment is Shen coming, but also the third step can be placed as the first step. For example, say, what pain? Oh, have so much pain. But you also can use the first step as the first step. Understand? You use Shen Tang, do my 20, and Anmian as a first step. Because without touch the low back pain or neck pain, by putting the points to regulate the Shen, the pain can be much better. So people the surgeon are not going to operate without anesthesia. First, they give people sleeping, give anesthesia. And during the operation, if anesthesia is not sufficient, then give extra shots. But anyway, operation is a kind of a causative treatment. Appendicitis, and this and that, they have to carry out the operations. Okay, so we repeat that we have to make a diagnosis according to the pathogenic factors, qi blood stagnation, and also we have to regulate the organ. That's the chief pathology, and also we have to find out the causative factors, as we mentioned: axonal invasion, emotion disturbance, and also diet disturbance, some disease, some operation, some constitution, and combined with geographic reasons, personal habits. Afterwards, we have to give treatment. First step is causative treatment, which is important. Then it's a symptomatic treatment or the Shen calming treatment. After break, we are going to discuss some detailed point selections to give some guide. With the illustration of a point selection, we go much easier for different treatment. So we take a break. We will be back at 2 o'clock. Okay, please stop recording. Thank you.
But
Oh, it has started. Who is recording?
me.
Recording in progress. I hear.
Okay,
Probably
good.
me?
I just
Okay.
pressed the button for recording.
Okay, I have maybe pushed some button. Never mind. Okay, let's
great.
continue. Probably it is
Problem solved.
recorded. Anyway,
Problem solved.
fine.
Okay.
Let's continue another part for general introduction, which is the most interesting part, is how to apply points, different points to deal with the situation. Usually, when we offer a prescription for pain management, we include these 3 parts in the prescription. First is that we can select local points. The place, we have to ask a patient, where is the pain, where is the place, which is important. For example, if people who have suffered from a headache, and you select the point of liver, large intestine, spleen 6, but you forget to select points locally on the head. So you are not able to lead the effect of treatment going to the head. So the local points from the head are very important. Of course, still on the head, different channels can be involved. So suppose people who have a front headache, you have chosen point at the lateral aspect, on top of the head, on the back side, etc. It is not working. So you have to select the local places, and also we have to decide which channel is involved. Because acupuncture treatment is based on channel distribution, channel differentiation, not only the pathology differentiation. So this is first point. 3-4 points at local places. If people have shoulder pain, you have to surely select points on the shoulder. But these local places normally should be selected latest, not the first choice. The first step is distal point. Especially distal points are selected as acute pain. Yeah, acute pain. So if acute pain, local is swollen pain, we try to avoid to select the points immediately on the local places and then select the distal places. So distal places mostly is the points are going to solve the pathology, the causative factors. And some also distal points are important because some unique points are local, are distributed at the distal places. And then we have to select some special points. What do you mean special points? TCM has unique function about points. So the unique points, which means that special points, including following aspect. So points, I believe that you have already, now you have the text, right? You also can see the screen. First is our stream point. Stream point. Okay, here is a stream point. Stream point. Stream point is responsible for joints, which is one point before the yuan point. But on the yang channel is like that. This is 1 point before the yuan point. However, on the yin points, liver meridian, kidney meridian, heart meridian, they don't have stream points. They only have the yuan point. Yuan point is also called a source point, or sometimes it's called yuan source point. It's the same because the different book has different the terminology. But anyway, yuan point is the fourth point on the yang channel, which is the third point on the yin channel. Now,
Excuse me.
Yes.
Sorry, but I thought like lever 3, Tai Chong was
It's
a.
also yuan point, but it's also stream point.
So, but
They
you just
share two
said,
functions. They share two functions.
but you just said that the yin meridians do not have stream points.
Yeah, but it's just yuan point is also stream point. Stream point is also yuan point. In for the yin
Okay.
channels. Yes,
But
for
they all-
example,
Okay.
for example, lung channel, lung 9 is yuan point, but it's also stream point.
Okay.
Yeah, therefore, the function of a yuan point, I will tell you difference. The stream point usually are necessary to be punctured for joint complaint. But don't expect that the stream point on the lung channel can be responsible for the joint pain on the large intestine. No, it's a difference. He's only responsible for joints along the lung channel. And also large intestine 3, for example, is the stream point. But large intestine 3 is only responsible for the pain on the shoulder, for example, frozen shoulder injury, right? But it is not going to be responsible for the joint pain along the lung meridians. You cannot expect the lung 9 is going to treat the liver joint pain. Not possible. Or people have a pain in the hip. No, not possible. Okay. But what is the function of a yuan source point? Yuan source point is responsible for the channel. What's meaning channel? In the meridians, we have mainly two big tissues. One is a channel, another is collaterals, right? The collaterals is tiny branches from the meridians. The channel is a main corridor, is a main distribution of this meridian, which is a more vertical, not horizontal. It's a big stream for the qi blood circulation. That's called channel. Collateral is only branches from distributing, departing from the main meridian. It is a horizontal. In order to regulate the main source of the meridian, which we have to regulate the yuan point. But the yuan point is not going to regulate the organ. Mostly it is weak to regulate the organ. It is very strong to regulate the channel. So now we have the stream points. We have the channel points. But what is going to control the branches? We have a channel and a collateral, which is a connecting point, low point. Low point is not same like the yuan source point. Low point is more responsible for the small collaterals disorders, big areas, not the main channel, not main channels. For example, I have a shoulder pain, but shoulder pain is exactly at the fixed point on the one places along the lung channel. So then you have to regulate the channel. But if I have pain departing from this lung channel and also some areas along these lung channels, it means collateral disturbance, channel and collaterals. You are regulating the channel, you are not able to regulate the collaterals. So you also have to regulate the collaterals. So collateral point on the lung channel is lung 7. We have 15 collateral points, but we only have 12 yuan source points. Each point, each channel, except the domite and the renmai, they don't have the yuan source point. 12 regular channels have yuan source point 12. But collaterals we have 15, and we have the renmai, domite plus one big collateral from the spleen. So we altogether have 15 collaterals. What is the accumulation point? Shiklet point. Shiklet point. Shiklet point is usually for acute situation. Acute pain, urgent pain, which is going to relieve the pain symptomatically. What is Shi? It's accumulating. Is the channel they have a circulation. But all of a sudden, there is a ditch, there is a depression, like a stream running away, running along the mountain. At a certain point, there's depression. So a lot of fish, for example, are accumulating in this small pool, a small depression. And these places is accumulation of qi and blood. So it means the qi blood circulation of certain movements, they're going to take a rest. They're going to get in together. So this place is normally if you feel like lung 6, you can feel there is a depression. There's a ditch. So this place is very important for pain, especially acute pain. Acute pain. For chronic pain with acute exacerbation, also it is okay. But for chronic pain, it is not working so well. For chronic pain, usually we have to regulate the yuan source point, low connecting point. Okay. That is 3 important points: through stream point, yuan source point, and low connecting point. Continue. 8 gathering point. 8 gathering point. Gathering point is not like a Shi-clap point. Shi-clap point is on the same meridians. There is a small depression, a small one. So this point is used for the pain along the same meridian. But the gathering point is something different. It means that our 8 kinds of energy, we have altogether 8. 8 kinds of energy are mostly in most cases is due to excess. They have disorders. They have disorders. no matter what is the cause of this disorder, we are going to touch this point because we want to treat this disorder. What are the 8 kinds of disorders? We have, do you still remember? We have qi, blood, zang organ, fu organs, tendons, vessels. We have the bones, marrows. Altogether, we have 8. Do you still remember? So suppose people who have, for example, disorder of the qi, and then it is due to emotion, it is due to food, due to external emotion. It doesn't matter. As long as there's a qi stagnation, we can use Renmai 17. Because Renmai 17 is responsible for qi. It's called gathering point for the qi. Do you remember for gathering point for the blood? What is that? We have blood, blood 17.
17.
Yes. So for example, there's a pain, stabbing pain, phantom pain, pain at night, pain due to operation, pain due to trauma, due to that. So instead of searching the meridian disorders, of course, we use Shika points, low point, yuan point. We can add blood 17 as extra point to promote blood circulation. And we also have a Zang organ. We have the Zang organ. Which Zang organ is liver 13. We have a Fu organ, Renmai 12, right? And we have the bone problem, arthrosis. We have a degeneration, osteoporosis. We have the blood 10. And this is the blood 10 is responsible for the bones, right? So now we have we have a tendons problem. For example, Achilles space problems. We have also tennis elbow. We have a golf elbow. They are all tendon troubles. We have carpal tunnel syndromes, right? So those guys, we have also ligament injury, cross-band of the knee difficulties. So there's all tendons. Besides, we can see all is due to injury, due to blood stagnation, due to damp heat. But we also can use directly the gallbladder 34 to be added, because this way we lead the effect, lead the treatment to the tendons. But I don't care. I'm going to put tendon is indeed the tennis elbow. Indeed, it is due to this. I use lung 9. I don't care. But no, it will be no effect, because lung 9 is responsible for the vessels. For cramp at night, for spasm at night, for cold finger, cold foot, for example, cold feet, due to syndrome of Raynaud syndrome. Because this is responsible for the veins, so the veins. So these 8 gathering points is not going to regulate, treat, but at least is going to lead the effect of treatment to certain places. Of course, it also can help for regulation of certain materials. We also have front move points. It means that our internal organ, you cannot touch, but you cannot speak to the internal organs. You have Zang organ, Fu organs, but they have reflecting points on the surface of our body, especially in front. That is called front move point, collecting point. For example, liver 14. Which point it is? It is a front move point of the liver. Indeed. So this is a good point to treat beside the liver 3, liver D, and the liver 14 is an excellent point to regulate the liver, to treat the liver. So suppose, for example, liver yang rising, liver 5 rising, liver yin deficiency. And you treat this yin deficiency of yang rising, but also you add for example, liver 14. So the treatment is marvelous. Marvelous.
Sorry.
Yes.
I thought I was under the impression that Qi-Man was more for this harmony of liver and spleen.
Which one? Liver 14?
Yeah, Qi-Man. The movement.
No, it has a broad indication.
Okay.
It is mainly from the move point. Anyway, its main function is to regulate the liver.
Okay.
No matter it is excess of deficiency, it's to regulate the liver. Of course, you see, if there's a disharmony between the liver and the spleen, you see, the cause is firstly is due to disorder of the liver, and then it starts to attack the spleen. You have to support the spleen, but meanwhile you have to, as a first job, sedate the liver. Liver 14 is a very good choice.
Thank you. The other thing I wasn't very clear about, I didn't really understand. When you said when you treat the luo, the collateral,
Okay.
you treat the yuan as well simultaneously. Is that?
Not always. Not
Okay.
always. For example, what time we selected only the low points, when there is only local disturbance, lower disturbance, or due to there is mostly external invasion. I give you example. Lung 9 and lung 7 at this point. Our time you selected the lung 9, what time we selected lung 7? The obvious is quite difference is quite clear. That when there's external invasion, there is runny nose, cough, shivering. It means the lower collateral point of the lung is disturbed. At that moment, we have to select the lung 7. But when people who have the chronic cough, long COVID, or yin deficiency, sore throat, throat dryness, should we select the lung 7 or lung 9? We select the lung 9 because lung 9 is a yuan point. Lung 9 is yuan point. So lung 7 is mostly for acute situation, especially external invasion. Mother point, Bakshu point, Bakshu point. Bakshu point is same like that as a front move point. Front move point is the point from the organ which reflecting in the front of our body is front move, but also it reflecting the points on our back along the first line of the blood meridian. Our each point, each organ has its own responding places, especially that those points are also working very well to regulate the internal organ. There's a common combination, front move point and back move point together. The effect is quite strong. For example, bladder, for example, Duma 8, right? Together with bladder 18. Bladder 18 is, do you remember? It's back move point of which organ? Liver, right? Bladder 18. So together in combined with front move point of liver 14. So one is back move point from the liver, another is front move point of the liver. Such combination can greatly help regulating, harmonize the liver. Harmonize the liver. For liver pain, liver disorders, okay, they are going to regulate. Tonifying, you can strengthen the liver. Reducing, you can control the qi stagnation, liver fire, liver yang rising, for example. Mother and son points, which is interesting. This is the way that in the situation when only one organ is involved, one pay attention, only simple condition. For example, liver is invading the spleen, for example, right? Or liver fire hyperactivity, not invading the spleen, but the liver yang hyperactivity is liver fire. For example, the neck pain, shoulder pain, for example, eye pain. So mother-son point is that have two meanings. Two meanings. The meaning one is that you have to choose the sun points from the sun channel. So here, I believe you have students have the text with you. I believe, right? Do you have the text with you? I believe she has distributed. Good. Which is called, okay, called horizontal point technique. Horizontal technique. So when it is excess, we take example, the liver, right? We take liver. Liver is excess. Liver is excess. Okay. Mother and son relation is that we have excess, we have to sedate. Do you sedate what? Sedate son. Excess, right? Due to liver fire, liver yang, liver fire, liver yang, liver qi stagnation. We have to sedate the sun. Look at here, point. Here, points are, okay, sedate sun. Sedation. Okay, sedated some point of the liver. Do you remember on the liver channel, which is the fire points of the liver channel?
Liver 2.
Liver 2, indeed. We have to sedate the liver 2 because it's the sun, it's a fire. Because liver is a wood. So wood produces the fire. So the fire points from the liver channel, which is liver 2, right? If you say I take liver 3, this is wrong, right? It's also which is the earth point. Fine. Now, also you have to take the organ from the liver. Liver is a wood organ. Which is the organ produced by the liver, which is the heart. Okay, it's clear, right? Heart is the organ produced by the liver, the sun. And then what is the fire points from the heart? Is the liver 8, sedated. Understand? This is the mother-son relation. So excess, we have to sedate the son. Is that clear? Probably it's not everything clear. It's too much. I believe it's too much, too fast. Okay.
You said that liver 8 is the fire point of the heart. That's what you said.
Liver. No. Fire. First, we start with for the liver channel. We start the wood. The first point, the liver 1 is a wood point. And the second is a fire, and then going upward. The yin, we have the pay attention, don't make a mistake. Otherwise, the 5 elements will be wrong. Fine. So here, liver heart 8 is the sun point of the fire, which is the wood of points from the heart. Do you remember?
Shenmen.
No. The heart 9.
Heart 9.
Heart 9, right? Okay, heart 9. Seven, which point it is now? Earth point. Earth point. After 5 is earth point. So it's not difficult, but it takes time to review. Just remember this system to consider. For example, this person due to emotions, right? Angry. I'm divorcing. I have a work loss. I have troubles. I'm a lot of angry, right? And then this lady or this man cannot sleep anymore. Not sleep anymore because so angry. You did not treat me well. You did not pay me well. my children not good to me, and that. So these are fight too much. But why she has to fight too much? She has chest pain. She has a headache because liver fire produced the sun fire too much. He's agitated. So we have to reduce liver 2, reduce the heartache. And then meanwhile, we use liver 3, we liver 14, blood 18, etc., with differentiation. So you will quickly control the person. After 1 or 2 treatments, people feel already better. Okay.
Wait, heart 8 or heart 9?
Heart 8.
Heart 8, okay.
Heart
Yeah.
8. Yeah. Must heart 8. Because it's equivalent, it's the 5 points.
Fire.
Not
2
wood
fire
points.
points.
A 5 point. Okay. Because the heart is the sun of the liver. So that is the mother sun point. But for deficiency, we have to tonify what? We tonify the mother. Okay. So if, for example, the kidney deficiency, okay, say, okay, I have a bone pain, lower back pain because my menopause, okay, kidney deficiency, or it's kidney deficiency. Kidney deficiency, we have to tonify the mother, right? Kidney is the water point, yeah, water point. So the mother, we have to tonify the metal points. Which is the metal points?
Kidney 7.
Kidney 7, indeed. Okay, good, yeah. And which is the metal points from the lung channel? No,
Lung 9.
No. 8.
Lung 6. Lung 8.
8.
Yeah. Lung 8.
Right? It's metal points. So we have to be familiar with the 5 elements, 5 points. Very good. You see? So liver should be tonified, no matter the yin deficiency of yang deficiency. We have tonified the mother with lung, the kidney 8, kidney 7, and the mother organ, which is lung, which is kidney lung 8. Right? Okay, fine. Doesn't matter some point. Okay, there's a minute. Fine. Next is the 4 commanding points. 4 commanding points is also mostly is for intestinal, digestive system, for gallbladder, small intestine, large intestine, stomach, and the gallbladder. These 4. It means that low C point. I'm talking about the low C point.
Hello.
Low C point. Low C point means that we have the certain organs. Okay, 6 full organs, not the Zhang organ. Full organs. They have actual connection to certain points below our or around our knee. Around our knee. Yep. Yeah. This is the easy way for us to stimulate, reduce the physiological function of the full organ is not same like the Zhang organ, because the key function of the full organ is to promote movement, elimination. For example, if there is large intestine pain, appendicitis, colic pain, irritable colon, you can use the stomach 37 is a low C point of large intestine. Last time. Besides, we can use stomach 25. We can use stomach 37. Why? Because this is low C point, reflecting point on our leg. And also we have for example, our stomach. It's reflecting also on the stomach 36. So stomach 36 is the C point of stomach, but it's also low C point of stomach. It has a double function. We have Yang Ling Quan. Yang Ling Quan is for all kinds of gallbladder conditions. Gallbladder conditioning. gallbladder disorders, stones, pain, etc. And bladder is blood 40, blood 39 is for the tube burner. So we have 6 points located around our knee, can be easily be touched. Then interesting is that at the commanding points is not working very well to regulate the problems, but it is a kind of a guide. Hits, Nederlands called hits. It can lead to the effect places, disease places. For example, here we said Zusan leads for stomach digestion troubles, intestine digestion troubles, and for our head problem, head tumor, have a headache, eye problem, tinnitus, ear pain, etc. We can use large intestine 4, but we also use lung 7 is for neck complaints, neck blockage, external invasion, etc. We also use Weizhong for low back complaint. This is a commanding point leading to the places. The last is the most important is also 8, we call it 8 opening points, 8 opening points. 8 opening points is also a special topic that is divided into 4 groups. 4 groups. Okay, but these 4 groups are fixed. Is pericardic 6 is fixed with spleen 4, and small intestine 3 is fixed with blood 62. And here also triple 15 is fixed with gallbladder 41, and lung 7 is fixed with kidney 6. But don't forget, these 4 groups, due to the places or the order of this number, we make 8 groups. 8 groups of points. It means that if we put everything in this order, pericardic 6 puncture first, then we puncture spleen 4. This way, it means we are regulating the yin channel. This is a commanding point, pericardic 6, and this is assistant point. Spleen 4 is assistant point. Here is spleen 4 is going to assist pericardic 6 to work better. But if we turn around, we puncture the spleen 4 first, and followed by puncturing at the pericardic 6, then the effect is different. It means that you are going to regulate the Chongmai, not to regulate the Yingmai. For example, you want to treat the dysmenorrhea, infertility, irregular menstruation. You have to puncture the spleen 4 first. It means that you regulate the Chongmai. So if we put the order other way around, you make another 4 group of points. Altogether, we have 8 groups. So 4 combination, 8 group of points result. And we often use, for example, 外观 and gallbladder 41. Gallbladder 41, if we put gallbladder 41 first, and then followed by puncture 5, must be in this way. Must be these 2 points are together punctured. But the first is gallbladder 41, and then 5. In this way, you are going to regulate the diamine. But if you want to treat, for example, people who have a neck herniation, a low back herniation, running at the lateral aspect of the leg, you have to puncture 5 first, and then gallbladder 41 secondly. Not the other way around. Which is very important. Is that clear? and not yet finished. If you want to treat you use the actual meridians. Ladies put puncture at the right first. Men firstly on the left side. Understand? Other way.
I think you're going a bit too fast for me. You said.
Did you have lectures on the actual
I know this is all new. This is
first time. It's the first time you hear.
No,
Okay,
we have-
I repeat.
We
Fine.
did it last year.
again.
Huh?
we studied it last year.
I did that last year.
We did it last year. Somebody maybe missed the lessons, maybe lesson or quickly forgotten. For men, you have to puncture at the left first. Left points first, and then the right points. For the ladies, opposite. First is right, and then the left. Is that okay? Fine. Because you have the recording, probably you can repeat afterwards. Listen to the recording carefully. But anyway, and this way of combination is extremely important. Especially, for example, people have abdominal pain, nausea, abdominal pain, stomach pain, esophagus, reflux, for example, burning sensation. Okay. What do you suggest to use a point? Due to emotion, due to digestion, so there are two extraordinary meridians should be opened. Okay. One is that you can open the yin wei mai. Yin wei mai, it means the pericarditis 6 first punctured, and then followed by the spleen 4. Number one. This is number one, first step. Second is used to use lung 7 first, and then puncture kidney 6. So these two groups of points should be punctured. Why? Because pericarditis 6 combined with spleen 4 to regulate the yin wei mai. Yin wei mai is related with digestions. For nausea, vomiting, swollen digestion. Very important. But why we use lung 7? Because lung 7 combined with kidney 6, it is regulated ren mai. Ren mai. People have a burning sensation in the esophagus. They regulate. But another patient came especially say, I have a lot of burden, a lot of belching. After eating, I have a lot of belching. Okay, so then it's chongmai disorders. Then we can add spleen 4 first, and then puncture the pericarditis 6. Yeah, spleen 4. So it's important according to the patient's complaint. Then you decide which point should be punctured first. But these 2 points must be together. Missing one of them is not complete. It's not complete.
Sorry, Dr. Sun, why is belching related to the chongmai?
Okay, fine. Chongmai usually is a lung meridian. For ladies, they are very important to form menstruation because chongmai collected all the blood, 12 meridian blood to form this menstruation. For pregnancy, very important. But second importance is that it must be regulating properly harmony in our body. So this qi is going to smoothly moving through chongmai, connecting different organs, connected the kidney, connected the liver, connected the spleen, and also connected the stomach going upward.
Okay, so it regulates that, like the chi mechanism.
Indeed, if Peilin is stomach chi is uprising.
Yeah, it's uprising.
Uprising too much. Stomach chi must going downward, not going down upward. So we have to regulate the chongmai. Don't let the chongmai bring the stomach chi too much. Of course, so that's why we use spleen 4 first to be punctured, and then we use pericarditis 6 This is the way. This is the way. Meanwhile, they are not regulating and treating the pathology. It's due to stomach fire, due to its food stagnation, due to liver attacking the stomach. They don't care. They bring just stomach chi downwards, harmonize the stomach. Of course, usually after puncture those 2 points, you have to treat the liver fire, liver chi stagnation, food stagnation immediately. Immediately. So this is acupuncture is very interesting. It's not that simple that you put the points, then you let people work. No, it's complicated, but it's interesting and very logically, very logical. Finally, is that for pain, especially pain on the top part of the body, superficial part of the body, you can use Ashi point. Ashi point is a place that is a kind of a painful place, like choke points. He is not going to regulate everything. However, he is going to make chain blood circulation temporarily improved. Because why people have a headache, why people have shoulder pain, not the whole body is painful, is because this localized place, it has chi blood stagnation. And therefore, local Ashi point can be the points considered to be used to promote the chi blood circulation. Lately, in the last five or 6 years, trick point or dry needling technique is getting popular. And so people, after following the one weekend course, a lot of physiotherapists start to use dry needling. But of course, they can use it, but it's not acupuncture. They call themselves as acupuncturists. It's far away because acupuncture, what is acupuncture? Is that is a kind of a medical act with the aim to help people under the guidance of TCM. So dry needling is not guided with TCM, without differentiation, without symptom differentiation, without pathology differentiation, without point differentiation. Where do you have pain? I have pain. I dry needling, put the points there. And actually, it is their puncturing at the Ashi point. Yeah. Sometimes it works. However, it's not TCM. So don't confuse the dry needling with normal acupuncture. Acupuncture is much more deeper. So here, finally, I'm going to give a very short illustration, explanation about the corresponding points. And this way is quite interesting because corresponding points is very logically divided the body into, especially the forelimbs, into 3 parts, shoulder, elbow, and wrist. And each part is corresponding to the same part on the another side of the body. Our shoulder is corresponding to our hip. Our elbow corresponding to the knee, wrist to our ankle. So if the ankle has some troubles, you can find some corresponding points, sensitive point, positive point, Ashi point on the wrist. But where to find? On the same meridian. Same meridian. Because our meridian are distributed exactly at the same places on our wrist and on our ankle. But with, of course, different name, but same, they bear the same name of TCM.
So the 6 levels, you mean? What we call,
Okay.
what we call the 6 levels, Juyin,
Indeed.
Shaoyin, yeah.
Yes, yes, yeah, fine. So we have 6 meridians which corresponding because we have hand Juyin, we have also foot Juyin. We have hand Taiyang, we have foot Taiyang. We have the hand the Yangming, we have also foot Yangming. but our shoulder must be same corresponding to the hip. So suppose we have shoulder pain, okay? Shoulder so painful, arthrosis or frozen shoulder, right? Suppose it is on the large intestine 15, right? Fine, frozen shoulder. But then you can find the corresponding point on the hip. And also the point which is shared same name of the large intestine, which is large stomach channel. Is it clear? You should not just expect that, yes, large intestine 15 is painful, then you found, oh yeah, probably she has pain at the gallbladder 30. No, must be same name, must be same name. How do you know the location per patient? You have to touch, found, and then it is opposite or vice versa. If people have the hip pain, for example, gallbladder 30, you can find the corresponding point on shoulder, bladder 14, triple 14. Right? It's similar. Don't expect that they will change another name. No, it's same name, same name. Or both Taiyang, Yangming, Shaoyang, Jueying, etc. Understand? For example, large intestine tennis elbow, right? Mostly is on the large intestine channel. Around the large intestine 10, 11. Around the large intestine 10, 11, right? Epicondylitis. So in this case, if you search the knee, because the elbow is corresponding to our knee. So if you found the knee, around the knee, which the points share the Yangming stomach?
Stomach 36.
Stomach 35, better.
Right.
But also possible stomach 36, possible one. Because, for example,
But large intestine 10 is corresponding with stomach 36.
Yeah, not exact 35. 35 is better.
Okay.
And if, for example, large intestine 10 is more painful, then you can find stomach 36 indeed. So around this area, then puncture is the most interesting. Quickly working.
Can I just ask that, do you puncture both points or just the corresponding one?
Both.
Both points.
Both. Yeah. And how do you think about the opposite? Do you prefer the same side, for example, tennis elbow, right? Tennis elbow on right side, okay.
Opposite, the corresponding on the opposite side.
Yeah, opposite is a good one, but comparatively speaking, same side is working better. Same side one, except that people have a paralysis, thrombosis, and then the same side doesn't work anymore. And then you use opposite. Usually same side. Understand? For example, largeness 11 is painful, tennis elbow. Okay, and then on the same side, the right side, also you find the stomach 35. We take a golf elbow. Golf elbow is hard 3, right?
Medium, yeah.
Medium, which is Shaoying, right?
Shaoying
of the hand. Shaoying of the foot, which one it is?
Kidney 10.
Kidney. So must be around kidney 10. Opposite also.
Yeah.
If you have injury playing football, right? An injury and it's kidney 10, then we also try to find the heart 3 on the same side, opposite. Yeah. But don't expect that it is a curative. It has a curative effect. No, it's only symptomatic treatment. Make cheap blood circulation better. Sedate pain. Regulate the channels. No, they are not going to solve the problem. If, for example, injury due to cheap blood circulation, due to rupture, so they are not going to solve anything. So you have to put the points, for example, injury, oh, knee so pain, don't touch me, at the place of kidney 10. Then heart 3 is good points. So puncture heart 3, and also maybe you can add some certain common point, heart 7, for example, and then immediately blood circulation. And also, for example, it is a tendon. So gallbladder 34, it is good introduced.
Can I ask something about what you said about using the other side for paralysis, for thrombosis? Because this week, a woman told me she has had breast cancer.
Yes.
She has shoulder tension on the side, but she doesn't feel the pain because of the radiation. So immediately I thought of what, because also Dr. Yang told us that in case of paralysis, you have to use the other side because there's more chi circulation.
Indeed.
So would it be also true for people after radiation that have dead cells?
True, it's true.
Okay, cool.
Because it's damaged operation, for example.
Yeah.
Big little scars. It doesn't work. It's so hardly blocked, but they have pain. So opposite is possible. Try to find if they have the tenderness, ashi point. Puncture this ashi point. There must be corresponding points. Must be. So this technique is often used simple for sport medicine. Of course, there is we call the turtle technique. Turtle technique, of course, I'm put the information here. So our on our abdomen, there is a certain way that we call the turtle technique. That the shape of the point selection can be considered as a turtle. So it is interesting to treat internal disorders and also extremities disorders. The advantage of this technique is simple. No syndrome differentiation. For people who don't have a big foundation with TCM, or they are in the first year, second year, and they already want to practice TCM, this way is simple. Yeah, because they can find their body disorders corresponding to the location of the turtle technique. For example, here is hand, shoulder, here is shoulder, elbow, etc. Here is the neck places, for example, who have a headache, who have, for example, migraine headache. I don't know much about the differentiation. So this technique is simple, like choke points, like ashi point, like symptomatic treatment. However, so if you are able to practice this and gradually you combine with your syndrome differentiation, then the technique is better. TCM is always encouraging people to practice different techniques, different possibilities, different method of treatment, with aim to help people as much as possible. For example, diet. For example, acupuncture, massage, moxibustion. We suppose we have used herbs. We use diet. We use qigong with psychological support. So TCM is not only with acupuncture or herb medicine. It's complex. The more the technique you have learned, the more possibility, the more door you are open for a patient. If you only have learned acupuncture, only use this turtle technique, of course, your treatment limitation is there, is quite obvious. But if you have learned diet, qigong, massage, moxa, psychological help, etc. herbs, of course, you have different weapons in your hand to fight with enemies, right? Okay, if you have nothing, you only have a fist to fight with the enemy, or instead of you have a knife, you have a pistol, of course it's different result. That's why I encourage you to learn, to take different courses, to learn different techniques. And also try to experience yourself. What is the best solution? What is the most, the technique you are satisfied? combine. In Chinese, they say, when you have the different possibilities, you increase the successful rate of truth, right? You only have one aspirin, you can treat the pain. Okay, somebody helped, you cannot treat all kinds of pain. But you have tranquilizer, anti-epileptic pills, sleeping pills, different kinds of strong painkillers, morphine, pump. Of course, you are pain clinic, you can treat all kinds of pain. Because in classical medicine, they offer this kind of treatment. They have no other choice. They have injection, they have shots, epidural infiltration, they can give anti-epileptic pills, give anti-depressive pills, etc. What else they give? It's the same as we. Yeah, try to learn different techniques. Okay, try to learn this called abdominal acupuncture or turtle technique. You have book of it, so buy books and study it. Yeah, just spend a few days, then you are master it. Fine.
Dr. Sun?
Yes.
I was at another school last year, so that's the reason I never saw the way you explained the confluence points. Is there a source, a book or a link that you could recommend that I could look into it, please?
To study what?
The confluence points, the way you've explained how to.
It's on foundations on Machochia. Machochia has a chapter dedicated to that.
Peter Deadman, all the books.
All the books have a chapter dedicated to that. Machochia goes a bit deeper.
Good. Help you colleague each other. You see, people are willing to give you some information. Contact them. If you have any help, we are ready to help you. Okay, because you are in the class, so we try to make you as satisfied as possible. Because luckily, the situation is not same like 35 years ago. When I came to Europe, there are so little few schools teaching about acupuncture, few books to read about acupuncture, but now plenty school, plenty colleagues, plenty books existing. So your chance is just spend time, you will learn it. Now, finally, we are going to learn about how to prevent disease, okay? Prevent the pain. Prevent the pain. Very simple to talk about prevent, but very difficult to perform, to practice. For example, okay, improve the body's resistance. So in this way, we do need some physical movement. In the last 20, 30 years, people's movement is getting lesser. Yeah, automatization and it's sedentary work, life. So people start work, they start to sit in the front of the computer from morning to the evening. At home, they're tired, they don't want to work. Take some ready food to eat, then they start sitting in front of a television to rest. So this is not the way. Secondly is that resistance need good care about your environment of the house, environment of the place where you live. Sunshine place, good isolation, humidity, not too much. And also you have to aware of your clothes. Try not to wear some synthetic clothes, chemical materials, a good material, cotton, be hygienic. And if you want pets inside, also pay attention, and they must be clean, and also this living environment is important. I mean, movement enough, physical movement. At least we need to have movement 3 hours per week. Do people have this movement? Yes, I have bicycle. No, bicycle is your routine way of life. You have to take something new. 3 hours a week at the least. But don't forget, we cannot exaggerate the sport as the healthy way of life. Do you know which country has the highest the longevity? Do you remember? Not Sweden, not
Japan.
Japan. Do people Japanese sport a lot? No.
But it's in a small island. It's a tiny portion of Japan.
Yes, not only Japan, but in general speaking, Japan is the highest longevity. So they don't sport so much. So we cannot put the sport as a priority. We do need to move anyway. We do need, okay? But the most important is what? That is the emotions. Emotions. Inside quietness, inside happiness, inside balance. This is most important. Most important. So this is the things is missing in modern life. People are unhappy because of family life, job, environment, different things. People are unhappy. Their satisfaction is lesser year by year. So this is our sociology big task. Big task. I went to Norway to give lessons a few years ago. I started to examine, are people happy in Norway? Because financially speaking, economically speaking, it is a well-developed country, has a lot of saving. So do you know the state of Norway has already saved enough money for their, not this generation, for their grandchild generation, they already saved enough money, right? But are they happy? No.
They have a very high suicide rate.
Yes, they have more than 50% of population ever in their life have depressing, long-term depressing, high suicide. Why? One of the cause is stress and also sunshine not enough. Sunshine not enough. You see? So unhappiness is nothing to do with your financial situation. Some people don't have much money, but they're happy. Okay, so emotion, try to regulate your heart, be happy, be relative. That's the most important. Most important. Then next about the diet. So if you take care of emotion, take a diet. In Japan, mostly they eat fish. They eat a lot of fish. Secondly, they eat a small quantity. A balanced quantity, balanced diet. This is important. You do need some meat, but the quality must be good. Yeah, but you need good vegetables, not too much carbohydrate. Not carb. You need maximally that people say 50% we need is a carbohydrate, but not too much. Carbohydrate is easy to buy, and it tastes well. For example, you eat a lot of sugar, you eat a lot of sweet. Of course, it can fill in your satisfaction. However, it makes you hungry again. So diet is very important. And next is about the organs. Organs. So many people are not aware of the healthy. They thought healthy is I enjoy your life. Somebody, medical doctors are going to take care of me for my health. No, health is in your own body. You have pain. Why you have pain? Except you falling down, you have some troubles. But mostly pain is due to your own mistake, emotionally, life, and activity, right? So organ balance is important. Suppose, do you know in China now about 30% people population has a cardiovascular disease. 30%. About 12% of people population has a diabetes. In Europe, only 6.7% of the population has diabetes, but China 12%. But the consequence of diabetes can cause a lot of troubles: cardiovascular disease, liver disease, kidney disease, joint disease, and a lot. So people are more unhealthy or sub-healthy than 30 years, 50 years ago. Do you know that in the last 35 years, the hospitals in Belgium are expanded, more and more beds, more and more hospitals, I believe, or similar in Holland. But are people more healthy? No, unhealthy. Why? Because life standard changed, emotion changed. So very simple for us to talk about the diet, emotion, physical activities. But the most important is that we have to treat the organ very well. But the current medical system is only giving you medications. Lifelong you have to take medications. Sugar disease, cardiovascular disease, you have taken lifelong disease. But it's not cure, not to try to solve it. Because it is very interesting for pharmaceutical factories to give you medication because they can earn money. If you have high blood pressure, you have to take 1 or 2 or 3. Then it's a benefit for the factories. They will not intend to use or invent a medication which can cure your disease. No, it's not interesting. No, because if your diabetes is cured, treated completely, okay, then they have no money anymore. Of course. So I believe it's a commercial potential existing everywhere. So anyway, if you have disease, you have to treat disease. One of the best treatment is classical treatment together with TCM treatment. Okay. Now, okay. We first take some treatment. Usually a prescription, I told you, if we use some local points, causative treatment, and symptomatic treatment. And how many points we should select? Around 12 points. So simple point, 2 or 3, 4, 5 is not possible. Usually points are selected bilaterals, except people have tennis elbow. If it's not related with large intestine, then you don't need to treat bilateral. Usually, if it is internal organ disease, we choose the points bilateral, both sides, both sides. If it is local channel disorders, we treat the one side. If, for example, say, I have hand pain, I have carpal tunnel syndrome, and I have injury of the ankle, then we treat it locally, fine. We are going to take some case. Now we take headache. Headache is quite common here in West, right? Including migraine headache, and including cross headache, including headache due to trauma, headache due to different kinds of things, tension headache, hormonal headache, etc., etc. But first of all, what we have to understand is that we have to make the differentiation. First differentiation is location, to see which location, which channel is involved. Suppose people who have a temporal headache, it's so young, and then you start to treat the front, the stomach, you treat the occipital, you treat the top, not enough effective. So the channel distribution, which channel are involved? Yang-Ming, Shaoyang, Taiyang, Jueying, etc. So we have to understand, ask a patient to show you where is the pain. Secondly, is that we have to prepare the patient to see is any changes, abnormal changes, hot feeling, nodulation, etc. To see, to identify, to discover which channel is involved. So that is number one. Secondly, is that we have to find the what is the cause? What is the cause? So if you only found the channel involvement without discovering the causative factors, treatment will be limited. Most cases is acute. For example, they have never had headache. Now they have for 1 week, 2 days, for 5 weeks. Long, shorter than 3 months, most is acute. And the acute case, the causative factor most is external inflammation. External inflammation, first of all, it is acute. It happens. Onset is very sudden. Secondly, they never had a history of a headache. Third is that they have external symptoms. Okay. Do you remember that we have to eliminate the wind cold and wind heat, wind damp, because the wind is primary cause. And if we only eliminate the wind, we are not able to solve all the pathogenic factors. Usually wind is combined with cold, heat, or damp. Therefore, we have to make differentiation. What is cold, what is heat, or what is damp? If people have fever, burning sensation, throat pain, yellow flame, it's wind heat, right? Okay, if it's running nose, white color, shivering, cold hands, it's wind cold. And if it's heaviness of the head, muscle heaviness of the body, and with also nausea, diarrhea, it is a wind damp. Why it is different? It's important. Okay, we have to eliminate the wind together to eliminate cold by moxa. By cooling the heat, if it's wind heat, by eliminating damp, if it's wind damp. Otherwise, you say, oh, it's wind anyway, I don't care. Lightning 4, maybe 3, spring 6, summer 7. No, it will not work. We have to identify what is the real cause. Number 1, okay. So here we have a different choice. Here for wind, no matter the wind cold, wind damp, wind heat. So those points are selected. Yeah. Lightness 4, triple 5, lung 7, goblet 20, blood 12. Sedate method, reduce method. So largeness 4 is responsible for head, right? Responsible for head, to bring the effect to the head. Anyway, also largeness 4 to open the skin pores to make sweating. Yes, okay. This is not enough. We use large triple 5. Triple 5 is used to also to make the Shaoyang function better. Why Shaoyang function better? Should I use triple 4? No, this is a low point. Shaoyang low point. Shaoyang is net. It's like a fish net. It's at the superficial part of the body. Shaoyang. And meanwhile, why should we not use triple 4? Because triple 4 is the UN point. It's not a disharmony. It's due to disturbance. So here, triple 5 is the interesting point, is a low point to harmonize this networking. So we have 2 points now. Large 4 UN point, make sweating. And triple 5 is to make the opening harmonizing. Is make sweating, harmonizing collateral. Not finished. Lung 7. Lung 7 is why used majority of common cold. You will see people have headache. with due to external invasion. No matter it's wind cold, wind heat, wind damper, they will have a cough. They will have cough. They will have a runny nose or throat. I don't care about the heat, yellow color, white color, but anyway, there's a cough. There's a cough. This is because pathogenic factors are invaded the body through their skin, through the nose, through the throat. They will not say, oh yeah, through your abdomen, through your foot. No, they through up part of the body, through skins. So cough must be there. Seldom see patients that they have cold without cough, without runny nose. Do you remember COVID-19? So severe epidemic, pandemic. The first complaint is the loss of smell, cough, throat pain. I don't care, 3 years ago. And the COVID test was quite limited. And there was a couple coming from Holland. And they went to, before lockdown, they went to Italy, have a trip. They came to my practice. And indeed, they had COVID. The lady had already fever, right? But we did not expect it. She said, oh yeah, but it's not in the room. I was somewhere else in the study. But actually, she had fever. But not that much. Husband did not have a fever yet. No throat pain. But she had throat pain. I was suspecting. At that moment, I did not wear my mask. We had a close contact. Yes. And then 2 days later, my wife started to have a cough, throat pain. She said, do I have a COVID? Lockdown started. Lockdown started. A few days later started. So 2 or 3 days later, my wife caught throat pain and lost smell. I said, it seems strange. But I suspected that the couple from Holland had symptoms. But I asked to have COVID test. That moment in Holland, in Belgium, it is impossible. It is impossible. Even you have fever, you have a cough, you have a loss of taste, they are not going to test you. They're not going to test you because they don't have the test. So my wife started to have fever. As soon as she had fever, I suspected, I confirmed that you are going to have the situation. So we went to the test, to the hospital, because lockdown started. Me too, to be tested. I did not have fever yet, but I want to test it. Hospital said, we don't test you. Until you have high fever, you are not able to breathe, then you come in, you are in the hospital, then we are able to test you. Do you believe that? It was true. So 1 or 2 days, so I immediately ordered herbs. I went to the company to fetch herbs for my wife. So my wife took the herbs. I also started to take it. 2 days later, I also have fever. And I had a lot of severe complaints, a lot more complaints, shortened breath, pressure in the chest, fever. I went to the hospital for the 2nd time. I want to be tested. No, you are not strong, not sick enough, because it's a Süßstoff saturation is still high. They're not going to test you. So again, 2 days later, it was 4 days later, too much high fever. And then via the medical society, I finally went to the UZ to be tested, because I'm sure I already had a COVID. And then they confirmed it's true. It is true, COVID. So it is the normal procedure, no matter it's epidemic, pandemic, it is influenza or common cold. As long as there's external invasion, mostly it is from throat, nose, skin. So lung savings must be there. So these 3 points are making sweating. They're not going to relieve the pain. No, they're not going to, because they are not special points. But then anyway, they're causative treatment. the major treatment. We cannot miss it. Meanwhile, for headache, gallbladder 20 is a good point because it is a meeting point of a gallbladder channel and a blood channel. For headache, very good. No matter it's wind, cold, wind, damp, don't care. See, so these first 3 points are very important too for general complaints, muscle pain, neck pain, sweating, lack of sweating, but they are not going to treat the headache efficiently. You have to use the gallbladder 20. And also you can use, for example, in-tongue action point, in-tongue. Do you know in-tongue? Okay. In-tongue action point. It's also good point for headache, to relieve headache. Bladder 12, what is good point? To support the first 3 points, to relieve the external invasion. But these points are very ordinary points to treat external invasion of cold. Maybe in time, maybe gallbladder 20 are able to resolve the pain, but they are not enough. They are not enough to treat the pain of a headache. But anyway, the first step to make the causative treatment. But if it is external cold, wind cold invasion, runny nose, shivering, cold, aversion to cold, you can use mox fasting. Must. It's benefit to use moxa, especially largeness 4, 5. Here is a question. Now in investors, you have a lot of moxa lamp. Do you know moxa lamp, right? Is that same like moxa? Rubbish. No, not at all. Why use moxa? Moxa is called okay. I is pronunciation love. Okay. So this is the love, the warmth you are missing. This external cold blocked the yang activity, Wei Qi, Wei Yang Qi activity. So now we are going to use the warm to eliminate the cold. Suppose you take a warm shower, it's also warm. You take a warm lamp, it's also warm. They are not same like moxa. Moxa is the warmth. It gives the same frequency as a human being. It's different. Our warm lamp, our shower, our warm temperature, our sauna, they're all not same frequency. If I speak my frequency to the dog will not understand me because we are not in the same frequency. If I see, I fear, the dog will not fear because we are not in the same level. But I hear is the only things, her medicine, which has same frequency as our body, which give the warmth. It can radiate through our skin, through our skin pores, through our needles, through our movement, enter to our body, take this cold away, to fight with this cold. But the warm lamp moxa is nonsense. It gives warmth indeed. It's not bad, but it will not expect the same moxa as what we should suggest you. So moxa here, mox fasting is important. Okay, not finished. So if it is, we use stop here.
Professor, can I ask a question?
Yes, please.
What do you think about smokeless moxibustion?
No, that's also not good. Not good. This is a commercial. It's not the moxa that they use something carbos is give smokeless. We must use moxa. And sometimes there's in the moxa, they add some warming herbs extra to give stimulation. So just speaking, of course, if you have too big practice, you have no other choice, because some apartment not equipped with alarm system. They are not allowed to use smoking detection, and therefore you are blocked. You have to use lamp. You have to use mox, smokeless things. But otherwise, I tell you, the best is don't use that one. Not yet finished. Okay, not yet finished. Indeed, you have to choose some points according to the different meridians. For example, if you, for example, in the Taiyang is blood meridian. So if you are expecting without adding points to treat headache, it's nonsense. You use yin tang, but yin tang is treated front headache. You use gallbladder, is treated the gallbladder meridians. So gallbladder meridian is okay, but not enough. You have to use some blood meridian. For example, blood 57, blood 63, blood 64. Reducing method. Do you understand? Because this is the 58. Do you remember 58? What is 58? 58 is low point. Harmonize the collaterals of the blood meridian, because blood meridian is going to the occipital region. And 63 is Shiklet point. Shiklet point for acute pain. 64 is the Yuan point. Okay, low point, Yuan point, Shiklet point. What else do you expect? It's marvelous. Marvelous. Yeah, this is blood meridian. Okay, blood channel.
Sorry, Dr. Sun.
Yes.
I just want to make sure that I understood. For if you've got a wind, cold, Taiyang headache, you will use all of the main prescription.
Yes.
And then plus.
Indeed.
Okay.
This last touch, you have to know which meridian it is. Right? Shaoyang. Shaoyang meridian channels. Okay. So in this way, if people have Shaoyang headache, right, and you use blood channels, nonsense, not working. Okay. Gallbladder, for example, gallbladder 34, gallbladder 36, gallbladder 37, gallbladder 40. Why? Wonderful. Because harmonizing of the collaterals, harmonize the channel of triple bomb gallbladder. For example, gallbladder 40, do you remember? It's a 4 Yuan point, right? Gallbladder 34, what point it is? It's the C point.
Yeah.
Strongly. And then it's the Yangming.
But what about if I have a Shaoyang headache? Wouldn't I use?
Okay, what do you say?
Well, if I have a Shaoyang, wouldn't I use Han Shaoyang also? Wouldn't I use white one?
Mostly gallbladder.
Mostly gallbladder.
Yes.
Because also of Juyi.
Yes, because
liver?
this is already Shaoyang is already low point gallbladder, Shaoyang hand. If Yangming headache, front headache, sinusitis, right? Headache, front headache, then we use Dumai 24, stomach 8. Okay, front headache.
Stomachache can also be used for Shaoyang. It's both Shaoyang and Yangming.
What's the question?
Jiawei, stomach 8.
Stomach 8 is front. It's for stomach 8. Stomach 8 here. No. Stomach 8 is here. Is here. Is here.
Okay.
Cross point of the front is here.
Okay.
Stomach 8. Okay. That is stomach 7. Okay. Stomach 7 is front. Jueyin headache. We use liver 3. Okay. Liver 14. Duma 20. Also sedate radiation. Okay, fine. For example, Shaoyang headache, also we can use Taiyang extra point, right? Also Taiyang. Okay. So this way, channel distribution are extremely important to decide for which meridian is involved. This is fixed. This is fixed. What we're going to change is this part. For example, if it is blood stagnation, if it is chi stagnation, we are going to discuss. So these channel differentiation are fixed. Here is for wind cold invasion, but wind feet invasion, fever, throat pain, yellow flame, what are we going to do? So these are not, don't use moxibustion. Don't use that, but use some herbs or use some points to clear heat. Right? How could we clear heat? We use the lung 10, liver latitude 2, and GV 14, not CV, GV, do my 14, reducing. So clear heat. So this group of points, the yellow one, plus the points here is the points with the green one. So it's clear the heat. Why? Do you remember? This is the yin point. This is the yin point. And this is the gathering point of all the yang channels. Clear the heat, reduce fever. If the damp is there, now we have to use these group points. Why? Because damp is going to block the digestion, block the triple burner. So we use triple burner 4 is yuan point. Yuan point. Yuan point is discharge the damp, and stomach 40 is resolve damp in the body. For you will see heaviness with the muscle, heaviness with the head. So these points are added to eliminate the damp. In this way, you see that we have causative treatment. We have symptomatic treatment, but we also have actual special points, Usually, headache due to external invasion, one treatment or twice treatment is sufficient. The reason is that because we make sweating, making people external symptoms also improved. Not only treat the headache, but also improve the internal complaints. Most important complaint.
Dr. Sun,
yes.
Can we have a little break?
Okay, good.
So?
Yes, good.
Then we can listen better.
Yes, okay. Shall we take a break till 4 o'clock? Is okay? Okay.
Or even less, up to you.
Okay, 5 before 4 is okay?
Yeah.
5 before 4. Okay, see you there.
Okay, thank you. Bye.
Sorry, Dr. Sun.
I believe. Okay, wonderful. Let's continue. And we also mentioned some special points, especially is the sun coming points. Should we use sun coming points in this case for external invasion? Usually no. Why? The external invasion, which cause headache, will not last too long time, for a couple of days, for a couple of weeks maximum. They are not going to disturb the sleeping, mind, restlessness, insomnia, agitation, palpitations. So usually it is not necessary. Secondly, the pain caused by external invasion is not that severe. So it is no need in most cases to use some calming points. But for internal cases, sometimes it is necessary. So we concentrate our attention for internal causes which lead to the headache. First is the internal case due to qi stagnation. The difference between the internal headache and external headache is that external headache is short duration, acute start, with slight symptoms and with symptoms due to external invasion, runny nose, throat pain, cough. But internally, usually it's long history for months, years, or it is related with your rest, not sufficient rest, overworking, or emotions. The first choice, and the first is most important, is qi stagnation. Qi stagnation can happen everywhere, but in most cases happens in the liver due to stress. Can also qi stagnation in the lung cause headache? The chance is not so big. Why? Because the lung channel doesn't has influence going to the brain, but our liver, yes. Do you still remember our liver channels? It is starting from the liver 1, going upwards until liver 14. Do you understand? But afterwards, it did not stop. It continues runs, but internally, not externally. Then he entered to the lung from liver 14. From there, he spread the collaterals on the lung. And from the lung, he moves further upwards to the pass through the neck, until the eyes. Not yet finished. From the eyes, he's moving forward to the brain and ended up at Dumai 14. So this is the internal circulation of the liver. When people have liver qi stagnation, people could have following symptoms: pressure in the chest and tension in the chest, sometimes difficult in breathing, sometimes throat pain, sometimes eye pain, and headache, especially headache in the temporal region, in the top, the top region of the head. And meanwhile, you can see that unhappy, depressive, sensitive, angry easily. So these are all symptoms of the liver qi stagnation. In this case, and typically we can verify this kind of headache is due to liver qi stagnation, is that when they're emotionally, they have more headache. When they're relaxed, less nervous, they have less headache. For example, during the holiday, their happiness, they less have headache. The moment that they have stress, they have headache. So we are going to treat mainly 2 aspects. First is to regulate the liver, sedate the liver, harmonize the liver, to let the liver qi circulate easily. So in this case, for example, you use liver 3, the yuan point, right? CV17 is a special point, it's a qi gathering point. Parathakal 6 is the point to harmonize the qi. And HA3 to regulate the sun. Blood 18 is to regulate the backflow of the liver. So usually I tell you, this way of treatment are very clear, shortcut, directly go to the liver. But would be sufficient? Normally, yes. Because liver qi stagnation is not at the age that produced liver fire. But next step, it will make fire generation or even liver yang rising. Then headache will be much more severe and aggressive. And also consequence of liver qi stagnation could cause liver blood stagnation, can cause dysmenorrhea, infertility, abdominal pain, sectors. And then the symptoms is that we can see clots in the menstruation, stabbing pain in the liver. But liver qi stagnation still is, relatively speaking, soft. Relatively speaking, is still reasonable. Therefore, we can use points to regulate liver qi. So these points are all necessary to liver qi, to regulate liver qi. If you add Duma 8, is okay, of course. It's no mistake. But usually 5-6 points is sufficient. Not yet finished. Yes. If these points are added, plus some point to calm down the mind, for example, calm down the mind, it's necessary. For example, 安眠、四神聪、晕糖, etc. Or you can, if you say, oh, I also can we add blood 15? Yes. Can we add Duma 11? Yes. But not too many. 2 or 3 is enough. 2 or 3 is enough. But we have to control this liver qi stagnation as quick as possible. After the treatment, people feeling much better, relaxed, easy, comfortable. They are very happy. I must tell you, they're happy, they're relaxed. See that method. In those cases, if you add herbs, it's plus bond. If you don't know herbs, it's also not the minus point. No, it's okay. So the treatment, what you have given to patients is not going to treat the headache, but also regulate the emotion, preventive for further aggravation. Important step. That's doctor. But if this step is not under control, they move to the liver fire, then it's something different. But don't forget, we did the points, it's occultative treatment. We did the sun coming points, right? Sun coming points, second point. But we also should add the channel distribution, like what we have discussed previously. Front, back, top, occipital to C. But mostly, in most cases, pain is at the temporal region, because the liver is connecting with the gallbladder. It also can be pain in the top. Yeah. So we have 3 steps: causative treatment, sun coming point treatment, and also the channel distribution treatment. Very clear, step by step, not hurry, not confusing, not making too much, not making too little. Sufficient. Guarantee you very good. If this step is not under control, we move forward. The next step will be liver fire. Because fire is due to qi stagnation existing in the body for too long time. Qi is a young energy. It's like a gas. Yeah. When it is compressed, and at a certain moment, it will explode, will make a fire. So next step is a fire. But nevertheless, if a fire is there, we can see red eyes, nervousness, irritable, restlessness, headache, and this headache is distending headache, burning sensation. But anyway, it's already too late. It's not at the qi stage. It's already the fire stage. If we continue to work with the qi stagnation, that's not enough. Because if there's fire, the house is burned, is on fire. The most urgent thing is not to save your material, save your property. It's extinguish the fire, control the fire. So here we have different fire points. For example, we can use with same points, qi circulation points. Same points, we add 2 more points. 2 more points. For example, liver 2, gallbladder 43. What points belong to these? Yin points, fire points. But can we use large intestine 2, for example? Or stomach 44, they're also yin point? No. Can we use the spleen 2? Also no. Can we use the spleen kidney 2? No. Although they are all yin points, but those points belong to different channels. we have to use the points which belong to the liver and gallbladder. Liver 2 is the yin point from the liver, radiating. Okay, it's 5 points. But in the case, did the 5 too much? Do you still remember? We can reduce the heart. Because the heart is this is the sun points, right? Sun point of the liver. But what is the sun organ of the liver? Heart. What is sun points from the heart channel? Heart 8. Heart 8. So heart 8 is a good point. In the case people have palpitations, restlessness, then we use it. It is wonderful. We often call this heart 8 as Jesus point, Jesus Christ. Do you remember, as the religious believer person, that after the 6 days, after the people who put the nail on the palm of the Jesus, he woke up. This is I saw one day a documentary, and they saw that this is the point on the, believe is on the heart 8. So heart 8 is a good point. I call Jesus point.
It's a painful point though for.
But doesn't matter. And after put, and they will see they are very quiet, not so much a fire. And the next time they will ask again. They will ask. Say, don't forget my points. Don't forget my points on my hand. They will ask for it. I have until now nobody refused this point. Please don't put this point because I'm painful. No one refused it. They ask for it. On the contrary, they ask for it. Don't forget this is my point, Jesus' point.
Can
really?
Yes. What kind of diameter needles do you work with?
0.22.
Okay.
Time 25. Yeah, winter needles. Yeah. Okay. So this point is good points. 0.22 is good. Not too big. 28, 30 is too big. 22 is too thin. 20 is too thin. 22 is okay. Okay. If the fire is not under control, next will be liver yang. Liver yang is a person who have a constant fire, constant redness of face, irritable, high blood pressure, begins to have some dizziness. So it means this is serious. Qi stagnation not under control, fire not under control. There is too much yang rising, right? So in this case, 2 or 3 points is sufficient. Not all the points I give here is a possibility. 2 or 3 is enough. So for example, I use 3 yellow one, right? 3 yellow one. Liver 8, gallbladder 38, do my 20. But why? It's calming down the liver yang, control the blood pressure. Because this fire is much more severe than the fire. We have to do some the He point. He point is deeper. Why? Because those points are the water points. Water is extinguish the fire, extinguish the yang. Okay, you can use tonifying method, right? Tonifying method to reduce, promote the water, to extinguish the water. The most important is the qi stagnation. Liver qi stagnation is a priority. Next is that another possibility, due to liver qi stagnation, it moves directly to the blood, not going to make the fire, but going to produce blood situation, aggravation, which is blood stagnation. Blood stagnation, you can see that patients have a headache manifested as a migraine headache, pain behind the eyes, stabbing pain, nausea, vomiting, because pain is too much. And meanwhile, they can have menstruation troubles, clots in menstruation, dysmenorrhea, liver pain, stabbing pain. So in this case, qi circulation can be few of them, 2 or 3, because qi stagnation is the cause of blood stagnation. You can still use, but majority you can use points for so qi stagnation you can 2 or 3, but majority is blood stagnation. Blood stagnation, you see, is liver 3, lung 9, spleen 6, even blood 17. Blood 17. Here, heart 3, lung 9, spleen 6, reduced method is for blood. You use latinus 4, liver 3 to make qi circulation. So usually this way of qi circulation is sufficient. Plus the point according to the involvement of meridians. Plus the point to calm down sun is enough. And also, I tell you, usually blood stagnation happens on ladies that it will cause dysmenorrhea. So points we use here are not enough to regulate the hormone, to regulate menstruation. So some points, they will tell you, oh, besides my migraine headache, it often happens during my menstruation. So we can add some point to regulate menstruation as well. For example, stomach 28, 29, spleen 6 plus pericardic 6 to regulate Chongmai and Renmai. But if people who have a blood stagnation in the liver cell, then the points to regulate the stomach 28, stomach 29 is not necessary. However, somebody who have a liver cirrhosis, for example, due to alcoholic liver cirrhosis, how can we manage the liver cell? We can use backside point, front move point of the liver. For example, liver 14 is a liver front move point. We use bladder 18 is a backside point. We use Duma 8 is the key point for the liver. So the points we use here, plus the point to use meridian differentiation and the same timing, are only treating, are the main points to treat migraine headache. If people have a liver problem or heart problem or menstruation problem, we have to also add some points, 2 or 3 points to improve the situation. This is the excessive cases. Axonal invasion, also excessive. Qi stagnation, blood stagnation, yang rising, phi rising, they're all excessive cases. Majority of them headache are due to excessive cases. Next is deficient cases that they have a headache from time to time. They have a headache when they are tired. They have not sufficient rest. So meanwhile, they have a head. The hair is dry, skin is dry, eye is dry, and vaginal dry, etc. Sleeping is superficial, so it's obviously is blood deficiency. Blood deficiency, you can see that the pale tongue pulses weak. On the opposite, at this moment, we have to tonify the blood, we tonify the jing. So see, you see, it's a C point. Okay. I show you here. Liver 8 is a C point. Kidney 10 is a C point. So tonifying method of those 2 points are able to improve the jing and blood, because jing and blood are equally balanced. Meanwhile, gallbladder 39, do you remember what point it is? It is the point
of the marrow.
Yeah, marrow. Marrow can tonify the blood. Also tonify. Kidney 3 is a jing. Yuan is the yuan point, tonify the blood. Stomach 36 to improve the spleen function for absorption of the food. Gallbladder 20 also tonifying to lift up the jing to the brain. Our brain is at this moment is empty because of the gene blood deficiency. And meanwhile, we use LIV3 is reducing method to move the Qi blood gene. And the rest is tonify or regulating, sedating the meridian, harmonizing the meridians, and also to tonify the Shen point to relieve the pain.
Sorry, Professor Sun.
Yes.
Do you mean gallbladder 20 or Do-20?
Dumai 20, GV20 is Dumai 20. GV20 is
Because I thought you said gallbladder 20. Okay. Then
no, not the gallbladder 20.
Yeah.
Not the GV20. Yeah, Dumai 20. Maybe it's all mistakes. So GV is Dumai 20. GV is Dumai. This is for blood. Meanwhile, we can ask patients to eat well of the diet, to eat some blood containing materials. For example, nuts, black sesame seeds, if possible, eat some meat. If people are not against the blood, we can ask people to eat bloodwurst, blood sausage. Usually, those kind of people who have a deficiency of blood are the ladies. They are vegetarians. Blood is empty. So they're even, in some cases, I ask them to, if they have chance to go to China, to take some placenta, and to put it in the capsules, to take one placenta capsules back to home to take it, because it's not for business, it's for their own purpose of health.
Which placenta, for human or from an animal?
Human, for human. That is important. Don't underestimate the placenta. It's such a marvelous material, much 10 times better than ginseng. Good. Ginseng 25 Qi, but placenta 25 Jing blood.
I've already said in this class that I still have a placenta of one of my children in the freezer for 15 years.
Don't freeze it. Let's put it in the oven under 80 degrees for about 1 hour, and then to see turn around, and then continue another hour until it is dry enough. Then smash it, put it in the capsules, 500 milligrams for 1 capsules every day, twice a day, each time 2 or 3 capsules, especially during the winter period. Don't take it in the summer. This is good.
I'm vegetarian, I would never eat it.
Okay. I, in my life, had to take 1 placenta. I remember very well when I started to study medicine, my hand was so cold, terrible cold, very annoying to have a palpation. And even to have a pulse palpation, I feel embarrassed because my hand was so cold. And then I did not know what to do. So one teacher told me, you should take 1 placenta. As a student, I have no possibility. So when I start to work in the hospital, I immediately asked one of my colleagues to give me a good placenta from a young girl, first delivery, healthy delivery, not too early, delivery not too late, not so much calcifications. And then I got one, I took one. Never I had this kind of a cold hand anymore. Never. Only one time, 1 placenta.
But Dr. Sun, actually, okay, maybe it's too long a discussion for now, but actually the hospitals are not allowed to do that without the mother's permission. You can't have that.
I asked you to buy in China.
Sorry, what about things like dangui and other herbs that promote blood in women? Would they not be equivalent to taking placenta?
What's your question?
Because there are, in Chinese herbology, there are lots of herbs that promote
I see, but not comparable. Not comparable.
Okay.
This is the best the best quality of it.
And so once you take it, would the issue be resolved indefinitely, or is it something that you would have to?
Usually it is, yeah, 1% is sufficient for people who have asthma, weakness, gene deficiency, infertility, etc. This is a good one. 1%. Okay. And the last one, due to headache, is due to yin deficiency. Yin deficiency mostly is liver yin deficiency, which causes the hyperactivity of a deficient fire. It happens often during the menopause that people have, for example, night sweating. People have, for example, also have feeling hotness in the head, restlessness, and also people have weakness, etc. Tongue is red, pulse is sweaty rapid. So yin deficiency diagnosis is confirmed. Therefore, we use again points, for example, liver 8. We use kidney 10. Why? To nourish the water, tonify. And meanwhile, we can also nourish the yin, for example, this spleen 6 and spleen 6 together with kidney 7. Why? It's metal points. Heart 8 is here reducing deficient fire. Deficiency yin, you have two possibilities. One is only yin deficiency without hyperactivity of deficient fire. Another is the one you have a lot of deficient fire, hot flushes, night sweatings, feeling warm, restlessness. It means there's not only yin deficiency, but also deficient fire. It means that yin deficiency is too severe, so the yin is not able to control the yang, therefore they have hyperactivity of deficient fire. So here is deficient fire control. If you add to my 4, to my 11, bladder 15, bladder 18, it is okay. It's okay. But not so many points because we have so many good weapons, good materials. We don't need to use all of them, but we have to select the points according to the certain rules, good directions, sufficient. But this is the costly treatment. If we stop here, without further help, without further differentiation of the point selection according to the channels, it's not enough. Or other ways around, only channel differentiation, sun coming without costly treatment, it's also not enough. So this is the way we are going to exchange the idea that we have to firmly understand to select the points fundamentally to treat the costly factors plus channel distribution, plus symptomatic treatment, plus some common points. So here, very interesting form. After treatment, we have to regulate to see which is the cause of this patient. Due to emotion, due to age, due to menopause, or due to external invasion, and then give some advice for patient. So patient will be very happy, and then they will think that you are not only the medical doctors or practitioners to help them with their pain, but also give good advice for their future prevention. Usually, I must say that a lot of people, before they are coming to you, they took different painkillers, sometimes severe medications. After acupuncture, they gradually diminish or stop the medication. So how happy they are. Meanwhile, their general condition, holistic situation will be improved. That's the TCM. From headache management with acupuncture, you can see that our treatment is mostly successful or fulfilled by syndrome differentiation, by symptomatic treatment, and by sun calming regulation. Next will be treatment of the next is neck pain. Neck pain, in fact, is same way as our TCM treatment for headache. The only treatment difference is that the neck is the location instead of the head. Yeah. The treatment of neck pain is much more simple than headache because the headache can be caused by some internal disturbance, but neck pain, not so much internal disturbance. Even, for example, people who have arthrosis, osteoporosis, due to age, etc. You looks like that it is due to the kidney deficiency. No, it is not. It's because that this degeneration or arthrosis or herniation or due to age mostly have symptoms of blood stagnation, meridian blockage. So TCM never gave a treatment or almost never give a treatment to tonify the kidney to treat the neck pain, almost never, because almost all the cases belong to excessive cases. We see again. So external invasion is acute. Someone, for example, standing or catching cold or sleeping in front of the windows and etc. With in the summer they have also electrical fan blowing wind or people sitting in the window with the car window open, something like that, or any cases, right? So it is caused again wind cold, wind heat, wind damp. And how do we know it is neck pain due to wind heat, wind cold, wind damp? Again, same like headache. So beside the basic situation, but they have external symptoms. They have external symptoms. What do you mean external symptoms? Runny nose, shivering, headache, neck pain, together with a slight cough, superficial pulse, acute onset. I never had a problem. Most is on one side. And headache due to the external invasion, most is both sides. And this is one side due to life disturbance. So with these external symptoms plus the neck pain, then we know it is due to external invasion plus the neck pain. So there's no other hesitation, no other choice to make, no other diagnosis to establish. So it is for sure neck pain due to external invasion. But we still have to identify it is due to cold, or due to heat, or due to damp. That's because this is tiniest difference. For example, runny nose is white, throat tension, phlegm is white, shivering, more cold feeling, it is wind cold. But the more yellow phlegm, fever, and also burning sensation in the neck, and also rapid pulse, yellow tongue, it's a heat. When there's heaviness, diarrhea, slippery pulse, it's damp. So that's the other tiny, of course. Then we treat with external invasion, causative factors here. No matter it is wind cold, wind heat, wind damp, largely for 2.5, again, these are the typical symptoms, typical treatment, typical point selection, no matter it is wind cold, damp, or wind heat. Make sweating, make harmonization, make lung qi dispersing, and make wind elimination. 4 points. 4 points. Are those points enough to cover the neck pain? No, they're only treating the external invasion. So runny nose better, cough better, shivering better, muscle pain better. If it's cold, moxa, like we suggested for headache. If it is heat, we do the same, like for example, lung 10, largeness 2. Enough. If it's still high fever, we add 1 more to my 14. Sufficient. More than that, not necessary. Even 1 of them is enough. 2 of them is more than enough. 3 of them normally is not necessary. Not necessary. So here we make sweating. Here we clear heat without moxa, of course. If damp, again, we have a different choice to eliminate damp. For the headache, we suggested the Sanjiao 4, stomach 40. But here we also have another choice. For example, Sanjiao 4, because this is relieve the yuan point, relieve the promote urination, eliminate the damp. We also can have, for example, spleen 9, right? If people have nausea,
sorry, Dr. Sun, you wrote small intestine instead of central.
What did you say?
You wrote small intestine 4 instead of central 4.
Yes, oh yes, indeed. Should be here, right? Okay, good, thank you. And then, if people have, for example, diarrhea, we use spleen 9. But if you say, I have no diarrhea, but I feel stomach is heavy, spleen 9 will not solve the problem. We can use limit 12. You see? But you see, I have not so much stomach spleen problem. I have heaviness of the muscles. Oh, muscles so heavy. We can use spleen 3. Okay, fine. So until now, all the points until now are not able to solve the neck pain. Neck stiffness, neck heaviness, neck. So immediately we use those points followed by points to relieve the neck pain.
Doesn't Hegu relieve neck pain?
Hegu makes sweating. Hegu here. It makes sweating. Sanjiao make harmonization with Sanjiao. Lung 7 is low point to making cough, sweating. Fine. But until now, neck pain is not solved. Not solved. Not solved. So here I must tell you, for neck pain, we have different possibilities. Here. These 3 points are local points to solve the neck pain. So it's a kind of a symptomatic treatment. Symptomatic. This gallbladder 21, when turn lower is gallbladder triple 15. You also can add some ashi point from 1 or 2 is maximum. So you have done 3-4 points locally. However, those 3-4 points, local points for neck pain, are supported by the syndrome differentiation, causative treatment. Mostly it is enough. Mostly it's enough. You don't need to use Anmian, H3, blood 15, blood to my 11 sectors. No, not necessary. Not necessary, because it's local stiffness. 1 time, 2 time treatment is sufficient. Pay attention to avoid the wind attack again. To sleep with the window open. Avoid to take some electrical fans, etc. So it's your life mistake. It's a life mistake. This is enough. This is a local treatment. Okay. And not yet all finished. Here come to this point, opening point. Okay, because people who have neck pain, neck is at the lateral aspect, mostly is at Saoyang. If people who have small intestine, people will have different pain. People will have scapular pain. Scapular. This is the place where small intestine passes through. However, most neck pain is Saoyang. Here we have talked about the opening points of actual meridians. Open meridians. There are two possibilities. One is that we open it with the we use the triple more 5 and the gallbladder 41. Another possibility is the neck pain, which has the involvement of the dumai. The neck is so stiffness. Neck is blocked due to dumai blockage. In that case, we have treated by using the point to treat causative treatment. We have treated the local treatment, but if we add triple 5 and gallbladder 41, it's not helpful to open dumai. Open dumai, we have only one possibility to do it is small intestine 3 and bladder 62, not other way around. So in this way, this is especially to open a dumai. But if dumai is not involved, why should we open dumai by using the point? No, leave it. If it's only the neck pain on one side, by palpation, you found, oh yeah, it is due to the sanjiao or gallbladder, then you use this combination. Yes. Mm-hmm. And then palpation, you have to do it to see this point on the sanjiao, this point on the gallbladder meridian, to see, especially at the yuan point, low point, Shiklat point, are they sensitive? Are there some nodulation, blockage, depressing, color changes, protrusions? If it is true, for example, you add the gallbladder 40. Oh, it's so painful. So painful. And then those points should be punctured. No, your point is not so painful, but low point is very painful. Or Shiklat point is very painful. And then puncture the points. Palpation is important. We have done so many techniques. Step 1, step 2, step 3, step 4. Finally come to the sun coming point. Because if severe pain, people will have restlessness, life, insomnia, etc. So we add some point, coming point. This is for external invasion. But normally you don't need. This is mostly for internal disturbance. For chi stagnation, people have neck pain. Is that the case? Same like a headache. That when they have emotions, they're tense, they're nervous. Okay, so much neck pain even can cause sometimes headache. But neck pain is the main complaint. Depressive, unhappiness, stress, nervousness, blocked by the troubles. So again, liver 3, yuan point, GV17, the qi gathering point, pericardium 6 is for yin wei channel to relax the mind, heart 3 to calm the mind, blood 18 the backsu point. You can add liver 14, etc. You can add gallbladder 34 if necessary. So this is the causative treatment for liver qi stagnation. They have different choice. For example, if you want, for example, you add dumai 8, dumai 7, bladder 7, bladder 18, 19, except they're all okay. They're all positive, but not too many. Not 20, 30 points together. So about 12 points is sufficient. About 12 points sufficient. So I told you here is that we have to give some good direction. This is for chi stagnation. Again, liver chi stagnation will make a fire, tension, burning sensation in the neck, nervousness. So again, we have to control the fire. How can we control the fire? Liver 2. Clear? We can also add reduce the heart rate. Do you remember? Heart rate, because it's some point. We can reduce the 42 gallbladder 42. It's also the yin point, large intestine 4. We still have, we can use another point to use to replace the heart rate. Which point do you suggest? We can suggest you can use pericardic rate. This is also a good point. Pericardic M, for example, pericardic. This is a good point because pericardic rate is has same function as a heart rate, Okay. Pericardic rate. Usually, pericardic rate of heart rate, one of them is sufficient. So here is very strong treatment plus the certain calming points. For example, 深思深冲, 安眠, for example, etc. They are going to calm the mind. Treatment is much faster than painkillers. Painkillers takes time. Half an hour, after 1 hour, it's working. But after a few hours, 2 hours, it stops working. You have to take 2 or 3 pills a day. However, the acupuncture is give 1 or 2 days relaxation, calm down, emotionally and also physically calm down. Liver yang rising, we have to use the point to use, for example, liver 8, tonifying method. We use, for example, we use gallbladder 34, also sedate method. So to treat the yuan point, we use Dumai 20 to sedate the liver yang. So these 3 points can be added. Basically, we add the group point for qi, group point for the fire, group point for the liver yang rising. Severe cases of liver qi stagnation can cause people have neck pain, blood stagnation. Do you know what kind of a blood stagnation it is? Can be hernia. Can be due to old age. Can also be people who have a severe neck tension and then can have trouble with blood stagnation. Usually, neck herniation is due to people who have wrong movement blood stagnation. So, for example, blood stagnation can due to some person who are physical labors. They carry something heavy, force themselves to move something physical, but also can be due to blood stagnation due to people who have office work without certain movement. Always sitting in front of a computer can also have a hernia due to stress. The typical symptom is that they have a stabbing pain, most on one side. And this pain can be radiating to the fingers, blood stagnation. Worse at night, stiffness of night at night. So in meanwhile, you can see that the tongue can be published. Typical symptom is stabbing pain, fixed location, long history. So it's enough diagnosis to make diagnosis as a blood stagnation.
Sorry, blasphemation, how do you spell that? Is it BLASPHANATION? I'm not really sure I understand.
You
what
means that this one, right? Okay, SP, for example, spleen channel, large intestine channel. Do you mean this?
You've said a number of times that physical laborers, office workers
Okay.
have this pain and it
Yeah.
turns into blasphemation. This is what I
Blood stagnation.
Oh,
What did she say?
Sorry.
Maybe not clear. Okay, blood stagnation, because stabbing pain, lung history, stabbing pain, a fixed location, radiation, worse at night. These are all the signs of a blood stagnation. So here we have to remove blood stagnation. We add, for example, those few points for blood stagnation plus blood 17. Do my 10 or 9. Also okay. Do my
you mentioned hernia and blood stagnation.
yes,
It's-
hernia can be
It's
coming.
I was under the impression that a hernia could, if it could also, if it doesn't follow the a Shan sickness, so it's not on the Juyin meridian, it could also be lack of contention, like holding of like kind of a type of prolapsus, you know?
Yes, okay. This is perhaps yes, due to the age, for example. However, when the collapse happens, hernia happens, they show blood stagnation. Fixed pain, stabbing pain, is the pain worse at night, stiffness. In this case, that is a hernia, and so we have different. So now you see, we use so many points to relieve the blood stagnation. Relieves blood stagnation. All the yellow points are removed, very strong. I must say, very strong. To my okay here, not 19. To my 9. To my 9. Okay, this is also the points when it is 1.5 turn next, it is blood 17. So they are together, right? They are together. They're together. So largeness 4, and liver 3 are moving the qi. The qi moving are going to promote the blood moving. Qi moving, blood moving. Not yet finished. Not yet finished. Blood stagnation. Do you know where it happens? Possibly on the dumai. Possibly on the gallbladder channel. So these points are also added. If it's cervical vertebral hernia, this combination must be added. If this local injury, somebody who is labor working, move something heavy, and always see a movement, for example, truck driver, they have to carry something heavy, and then it is local injury, tearing, muscle tearing, then you can use 5 and gallbladder 41. But mostly hernia is a small intestine 3 and blood 62. Yeah, 62. So this is most interesting. Emotionally is due to qi stagnation, fire rising, yang hyperactivity. Due to physical damage, injury, herniation, blood stagnation. Another type is blood deficiency or yin deficiency. are those people, especially blood deficiency, that those people who are aged, right? They're not really herniation, but degeneration, related with their tiredness, related with their overworking, and especially that the pain is up and down, from time to time, and especially that when they are tired, they're weak, they're not good rest, then they have pain. So in this case, both sides. Meanwhile, we will see they have low back pain, poor concentration, low memory, weakness. However, we are going to tonify. You see, all the points with tonify method, yuan points are yuan points. We have the C point. We have the marrow points, C points, tonify. Meanwhile, we also again do my 20, benefit the bones. Can we use as a point, for example, bladder 11? Yes, of course. This is a good point, is regulating, supporting the bones. These are good points. Level 3, reducing. To make the qi, jing, marrow movement. Finally, is persons who have yin deficiency of the liver, kidney, dizziness, blood pressure too high, from time to time, thirsty, poor vision, tiredness, night sweating. What are we going to do? Tonify, nourishing, and reducing. This is only for person who have much night sweating, hotness, restlessness. Then we use lung heart rate, reducing. But rest is tonifying. But if they don't have night sweating, not restlessness, and then you just tonify. Bladder 18, we can add, for example, many good points. For example, bladder 18, bladder 23, bladder 20, receptors GB8, GB. Receptors, there's so many good points. In acupuncture, if you're a good acupuncturist, you should not worry that you haven't studied the herb medicine. Of course, if you have a chance to study herb medicine, it is really a plus point. You can achieve good result. But if you don't having the chance to study herb medicine, as long as you can perform acupuncture as its a profession, it is enough. You will be satisfied by acupuncture. You will be enjoyful, cheerful that you can help so many patients. It's really amazing. Acupuncture can help. I guarantee you that acupuncture is especially working for energetically, working very well. For mental disorders, working very well. It works better. For mental activities, usually herb medicine is working better than acupuncture. However, we don't have so much material available now to compatible with acupuncture. Why? I tell you. Previously, let's say 50 years ago, we have a very strong herb medicine to improve insomnia, which is tiger eye. Do you know tiger eye? Tiger is a big animal, cat animal. 50 years ago, 60 years ago, in China, it was disaster to have tigers. Too many tigers. Tiger came even from mountain to the village to bite people, to eat people. So there's plenty animals, tigers. So they are going to catch tigers. One of the medicine we use tiger bone is bones, tiger bones. Tiger bones. It is very good to treat bee syndromes. To treat bee syndromes. Bee syndromes. However, now tiger is forbidden, protected. It's criminal to kill the tiger. But the eye of the tiger is the most marvelous herbs to treat the insomnia. Yeah, to treat insomnia. And it is the best one. But now we don't have it. 50 years ago, only rich people are able to pay the tiger bone, the tiger eyes. Maybe 40 years ago, still available to have tiger bones, to have alcohol production to treat the tiger bone, to treat the bee syndrome. So now it's not available, it's forbidden. So we don't have it. Also, to treat insomnia, there is cinnabars. Cinnabars. Do you know cinnabars? It's a kind of minerals which contains contains mercury. Do you know mercury? Creek. It is forbidden. It is forbidden. And because it can cause toxification. But in China, when so many years ago, it was allowed. It is, but the cinnabar is not going to in the decoction, to put in the decoction. It is, the pills are coated with cinnabar. For example, just check if you have time, called Tian Wang Bu Xin Dan. This pill was made, okay, and then at the end, they coated with the cinnabars because it's red color. Heart is organ with fire, is rare, belong to the heart. Heart likes to see red color. And so the heart accepts the red color pills easily. But actually this pill is heavy. Cinnabar is a mineral. It's very heavy to sedate the mind. Very good one. For people having insomnia, it is working marvelous. But don't forget, you cannot take it a long time. Otherwise, you have a mercury toxication. And another one is called Zhu Wan. Also check. It's also pills for insomnia. Also contains Zhu Sa. Zhu is Zhu Sa. So, but now we don't have tiger eye, we don't have cinnabars. What else? Nothing left. We have this and that herbs. It is far more weak. Far more weak. Okay, and but acupuncture, it is working very good. Why? It's the emotion. It's the energetically. It's something too much disturbing the heart. So acupuncture points are working very well, very well. I speak 3 times. Very well. Why? It is really helpful for people for insomnia. If you use properly, pay attention, use it properly. So here,
apparently, Sun Simiao used to take a lot of cinnabar. And he lived a really long time, and I've been trying to understand how that's possible because he was like 103 when he died.
Yeah, okay, 103. Fine. Usually, I let you know, when syllabus is taken, people can be high, can be calm, but can be high, because it's toxicated. And also this heavy metal is not reversible. If it's accumulated in the kidney, can be caused kidney damage. Don't forget, in old China, people only live 40, 50 years old. The people pass away very, very quickly. So when you are 40, 50, after 10 years, you are intoxicated, you have kidney disease, you are already dead. But people have no idea. But actually, it is forbidden now in China, even in China. But still, according to the pharmacopy in China, these two herbs are still allowed. Of course, you have to follow up your kidney function when you take it, right? And to see every month what's the situation of your kidney, creatine, urea, and the function of the kidney. Okay. Okay. To see this function, this is to examine you how your kidneys function is well. More than 60% is okay, but if it is less than 50%, you have to stop immediately. Okay. Today, now it is 5 o'clock. Today we are going to stop here, and we are going to finish rest part. Don't forget, tomorrow we are going to cover the aspect of B syndromes. Still, we have to cover a lot. Let me have a look. Who is going to ask question? Maybe you have a question and answer.
I do.
Okay. Do you have I see. So you don't have special other questions, right?
I've got a few questions from the previous section. You talked about dried up blood, and you gave as symptoms dried skin, dried eyes.
Blood deficiency, right?
Blood deficiency, yeah. And I was a bit surprised because to me, I would think that would be more of a yin deficiency, like a liver yin deficiency. So how, it seems like a really fine line. How would you, is there anything else that would give you an indication that it's more towards the dried blood as opposed to a yin deficiency?
Okay, very good. Blood and yin belong to the same material, but still they are a little bit different. Qi and yang are one category. Blood and yin belong to one category, but still blood deficiency is not the same as yin. Blood is something material, liquid material, which is nourishing the skin, hair, eyes, joint, etc. So blood deficiency has more dryness, dry skin, dry hair, dry eczema, dry eyes, like that. So you can see, if you touch the skin, it's more rude, it's a blood deficiency. And mostly it's a blood quality of menstruation is also scanty menstruation, little menstruation. Okay, but this is blood deficiency. Tongue is pale. But yin deficiency is also another liquid, but compared to the yang, it is controlling in harmonizing with the yang. So if the deficiency of the yin, it can have internal heat. Blood deficiency, no heat. Blood deficiency is only dryness, little blood quality. But yin deficiency is night sweating, thirsty, and also hotness, night sweating, red tongue, etc. So this treatment is different. Yin deficiency more nourished yin, clear deficient heat. Blood deficiency more is moist in blood, a little bit different. Okay, but most points are a little bit the same. However, slightly different.
I was also wondering, you've spoken about tonification of needles, and this is I'm very confused about the subject because I've had discussions with practitioners and even with my current student group where there is this opinion where if you just put in the needles, you do not need to disperse or tonify, that even putting the needles in, that's sufficient work. So
Oh, no. Who say that? Because put the needle in is not to put the rice plant inside the water. You have to give some, like for example, if you turn on the radio, right? It is not enough for everybody to hear. You have to put the increase the volume, right? To clockwise, to turn it on. But if you say, oh, too loud, somebody did not turn it off properly, it's too loud. You have to clockwise turning it clockwise. So when you put the needle in, it's not finished. You have to obtain the qi, the qi. Lifting, thrusting, rotating, lifting. You have to do this technique. But until now, it's not yet a treatment. You only have the insertion needle and the qi. That's all. But then you have to decide which direction are you going to do. Tonifying or reducing or in method. Without the third step, you are going to fail. You have to do.
I wonder if perhaps maybe different schools of thoughts like Japanese or
that's not a traditional Chinese.
okay.
No, I see. You have to do tonifying and reducing. Okay.
Okay.
A Japanese needle put so small needle inside. It's not a TCM. So small, plastic one. Japanese needle put in, but it's another school. It's not TCM. They don't make some differentiation. TCM make differentiation. The best, I think, I tell you, is differentiation. Differentiation. Yeah. Okay, good. Fine. Any other questions, please? If you don't, I thank you very much. I will see you tomorrow at 10 o'clock. Thank you. Bye-bye.
Thank you, Doctor.
Have a good evening.
Bye-bye. Bye-bye.
Thank you.
Bye,
Bye-bye.
everyone.
Bye.
Cheers.
Bye-bye.